Morning, everybody.
Good morning.
My name is Mike Mitchell. I'm the Environmental Health Preparedness Coordinator up in Central Office in Tallahassee. My blue sky job is to do trainings like this throughout the state, train the EH staff on resources, ways to respond, and during my gray sky job is if the state EOC, the Emergency Operations Center, gets activated and there's a request for resources through EH in terms of an EH strike team, need information, need press releases, stuff like that, you can go through your EOC to get it up. It'll come through my desk to wherever we need to go. Either I'll work on vetting the names of the strike team people, or I work on getting you guys the SME if you can't get in contact them, so we can get you the answers that you need so you guys can keep doing your job. You know, it's hard enough, you guys are the boots on the ground, you guys are the ones having to respond, and we just need to get you the resources so you can do your job as efficiently as you possibly can, which sometimes isn't that efficient, but you do whatever you can. So on the agenda, we have like 5 things listed. I'm just going to be, because I know some people they look at the agenda and they say if you're not done at these times, you know, clearly we're either not going to get done, or I kind of threw 5 topics out there and they came back, yes, train on that. So it's kind of all merged together. So it's not going to be, we're talking about those topics at those times. We're going to be talking about those topics throughout this presentation this morning. So I just want to be upfront, and just so those people who say, you know, this is what time you're supposed to be done, it's not going to be necessarily that way. But we are going to hit those topics. And at the same time, if I hit a topic and you guys want more information on it, ask questions. This is your time to learn. I know the material, but you know, you got me here, ask the questions. You can also learn from each other. There are a number of you guys that I know have responded to different things. We have one person who went to Matthew, we have one person who went up to Iowa. So our response isn't necessarily just in the state of Florida. Did anybody hear about a hurricane going on right now?
Yeah.
Did you know that Florida's already gotten some requests from Texas from that? And so, you know, right now it's all those initial first responder type of things, you know, search and rescue, things of that nature. But we know that there's going to be environmental issues going on. We know a large area is going to be hit. How many people were working in 2012? Okay. We had a storm, a tropical storm, Debbie. It wasn't a hurricane. It was a tropical storm. Should be no problem, right? Except when it just sits and drops 30 inches of rain in 30 hours, and the ground is not set for that. And that's kind of what Harvey's doing right now, is, yes, it's a hurricane. It started as a 4, we're down to a 2. Tonight it'll be a 1, tomorrow it'll be a tropical storm. But it's just gonna sit there. And they've had estimates of rain anywhere from like 40 inches to 48 inches. Most places can't handle that much rain in that short a period of time. So you're gonna have flood issues. And then if you have flood issues, then you're gonna have, what other issues will you have with flooding? Power outages?
Water, power,
Sewage.
rain, mosquitoes, vermin, all sorts of shapes and sizes.
And how many of those things does EH somehow get their hands involved in? Exactly.
Yes.
And then you also have some Stimson back there. I'll throw out mold, you know, or mold-like substance out there, you know. And so, you know, so we have, you know, there's a lot of things that we get involved with, you know, in one sort of type event. And so there's a lot of things we got to look at. But the nice thing is most of the time, you know, it doesn't matter if it's a thunderstorm or hurricane, you know, water is water. Our response is going to be kind of similar across the board, which makes it a little bit easier. So once you've dealt with one thing, it makes doing it again, even if it's a different named event or whatnot, it's still the same type of response. And that's the nice thing. So, Do you all know each other in this room? I'm just wondering. Well, I'd like to kind of quickly go around just to say your name, where you're from, and if you were involved with any kind of emergencies since you've been working at your current job. We'll start out with Gary.
Gary Schneider. I work for a company called Integrated Mission Support Services at the Kennedy Space Center, and as senior sanitarian, I manage the public health program for NASA at KSC. So, and yes, Matthew last year and all sorts of other things in my other lives with the Department of Agriculture and Department of Health. So yes.
We got lucky with Matthew with it not having a direct impact, but you guys got a good amount of wind down there.
We got a lot of wind, and we're still dealing with trying to recover certain areas because of, as an example, took the roof off the child care center, which, you know, people weren't, when they finally came back to work, wanted to bring their kids there. And, you know, so there's still a lot of mold problems out at the Space Center, a lot of old buildings that still haven't recovered well.
Yeah,
So, yeah.
Jill Wallace. I am a former Department of Health employee. I worked in Polk for a number of years, and at that time was involved with Charlie. I now own my own business and train dogs full time.
Excellent. What's that?
Wesley Asplund, Environmental Health Director for Dixie Gilchrist, Levy County, Florida Department of Health. I've done Storm of the Century in '93, 04 and 05, did a 30-day boil water notice in the coastal community, and then last year, yeah, you've been there long enough, you've done it.
Julie Goodwin Palm Beach County, and I did do work with Francis G. and Vernon.
Okay.
Wendy Duncombe, Palm Beach County, same thing. We did the community assessments for Francis, Jean, and
Alice Murkowski from Palm Beach County Health Department, but I'm new, so I haven't had that chance yet.
Just wait.
Just
Be excited.
I'm Pat Fricano. I'm with the Florida Department of Health in Palm Beach County. I've been around for 28 years, but I've lived all over the state, and it seems like wherever I go, I miss the major storms. So,
Glad you're here.
I'm back for those Thursday.
Sir?
Yes, Patrick Peck, Seminole Tribe of Florida. I volunteered in the EEOC for the tribe for well-known Charlie.
Excellent. Not to get off on subject, had you heard about our new EH guide that we made for the Native Americans?
No, I have not seen it.
Okay, I can bring it up a little bit here, but we can talk offline.
My name is Bob Sokoliskis, and I'm retired after 35 years. And yeah, I was involved in Charlie and was stationed at a feeding place and helping people out. It was a blast, actually. I had fun doing it. And, so now I'm just enjoying life, and I train dogs as well.
Excellent.
He's filling me on a web, so it's a bit of...
Oh, okay.
Sorry to be late. I'm Sandra Whitehead. I'm with the National Environmental Health Association. I used to work at DOH in Tallahassee, so we worked at the EOC. They brought everybody over. So
Yeah, well, they've done things slightly differently since then, because I've learned. But and some of these pictures may look different from when you went over there. So, but thank you for joining us.
My name is Brandon Torado. I work at the Department of Health in St. Johns County. We both, myself and my coworker, we both worked at the special needs shelter when that got activated, and then we worked in the after response team.
Sean Ryan, Department of Health in St. Johns County, and yeah, same situation. Response for Hurricane Matthew.
We got a couple of pictures from about St. John's and what we've done in here. So, Brian.
Brian Miller. I'm currently the environmental administrator for Hillsborough County with Department of Health. Actually, my roots go all the way back to Andrew, but really eye-opening with Charlie, because that's when we really started building up response. Anytime you've got a big lapse like we do right now, things start kind of relaxing and people start forgetting. So that's going to be kind of a scare. And then I was the one deployed with Mike in Iowa, which was very interesting.
You know, when you have all these storms like we had in 04 and 05, you know, you get really good at your response because that you're used to it. It becomes, which is bad to say, it becomes part of the norm. You know what to do, you go do it, and everybody gets into their routine of what they need to do. Then you have 10 years without a storm. Like everything, you always have that turnover, and you lose some of that expertise. And you got to retrain on how to do this again. So even though the state's been doing this for a long time, the people have it in their positions, and that's what we got to constantly be kind of training and educating, so people will be prepared to do that.
Mary Mooney, Hillsborough. I was on the strike team that went to Flagler and St. John's after Matthew.
Excellent.
I'm Cindy Morris. I'm the assistant director in Hillsborough County, and looks to be a Brian over there in environmental health. So the 2004, I was at the EOC for all of those filters.
Excellent, thank you.
Health Department in Sarasota County. Charlie happened about a year before I started there, but I can talk about not being prepared, even as not a state employee, and being in the house when your house is being destroyed, because I lived in Port Charlotte, and what a mess it kind of was after the storm happened. So that was a pretty big mess. But since I've been with the health department the last 12 years, I did get activated once for a special needs shelter, and we cannot remember what storm that was.
Yeah, some 2012 perhaps.
It was about 5 years ago.
Somewhere in
So
that week, yeah.
So yeah.
I'm Aubrey Spears. I'm DOH Sarasota County, and I've been with EH since 2002, so I did a lot of shelter duty in 4, 5, and 6. A lot.
Okay, my name is Bob Belmont. I'm the Pest Prevention Training and Technical Director for Massey Services. We deal with all the pests that these storms stir up.
Ava Johns, I'm in the Tribe of Florida Health Department. I work with Patrick, and I usually do pre-hurricane EOC coverage.
Okay.
Alicia Whittingham, DOH Palm Beach. I'm on the strike team, but I haven't had any. Yeah, only been there for a year, so.
You got to start somewhere.
Tim Willis with the Florida Department of Health with the Radon and Indoor Air Program. I've been around for 27 years. So I did work in the special needs shelters, working in the county health departments back in the 90s, and I can't remember the sort of name. But since I've been in Tallahassee, I've worked at the state EOC during hurricanes of 2004. I've been on the environmental health strike teams, but I haven't been deployed yet. But probably the reason I'm not deployed is because I'm also an SME up in Tallahassee for mold issues and carbon monoxide and stuff like that. So being deployed would kind of take me out of that role, so I'm not sure how that would work. On the other hand, I also get involved with the nuclear and radiation emergency response teams across the state for the Department of Health as well.
Thank you. Greg, do you want to say anything?
Well, I'm not officially in the class, but Greg Crumpton, environmental administrator for Pasco County, and been involved in storms since the small one we had with Hurricane Andrew.
And Greg is also part of a hazmat team, which is kind of interesting.
It is. It is. I mean, that's like I said, it's
Become an amazing expert.
Yeah.
And become a sinkhole expert.
Yes, yes, you are. Yes, you are.
And that's an emergency all on its own.
I'll give you just a little bit of my background, and then we'll get into the fun stuff. I started in 04, a month before the first hurricane, so you can blame me for all of them hitting Florida. And I'll tell you, that was a learning experience, you know, when to be just thrown into stuff like that. So I was down in Marion County during the 04-05 hurricane seasons. I then went up to, during that time I went to Iowa with Brian, and I got a couple stories that I'll share with you guys throughout this presentation of things that happened, and how, you know, we may not have a direct role in some of those things, but how, you know, just being there for people, just being there for your team, but, you know, the public. And you go to another state, and you say you're from Florida, and I thought, you know, first that they would just kind of push us away, like you're not from here, you know, just, you're what are you trying to sell them? But really, they just want help. They just need a direction, because when you lose a lot of things very quickly, it's hard to just know how to start moving forward. And if you can give someone just a direction, it's amazing how much they will just, you know, they thank you and how much good you can do, even though you may not necessarily be related to your, you know, EH, but just being there for someone does a lot. And that's what you got to do during emergencies. Then for the next couple of years after Marion County, I was the EH director up in Suwannee and Lafayette. Like I said, we had Tropical Storm Debbie that we had a lot of rain, and we have a river that goes around our county, or Suwannee County, and normally that's where the flooding is, and people are used to that. It was when the center of our county flooded and had like 6 inches of rain, had feet of rain, and we had some houses that had water up to the top, and there was no lakes or anything around these houses. You know, it's just things you don't necessarily imagine should be an issue become an issue when the ground can't absorb the water as quickly as we have. And we had a whole bunch of sinkholes that opened up at that time. We had about 200 sinkholes that opened up right after Debbie. So we had that issue going on. We had sinkholes open up near our wastewater treatment plants and had water gushing in there. And so we had a lot of different things that went on. And now I'm up in Tallahassee, and I've been at the county EOC, I've been in front of cameras, and I've been working up here. I got Hermine and Matthew that I did some work up at the state. So I've seen all the different levels. I've been deployed, I've been there, so I have complete respect for all you guys who are out there trying to do this day to day, because I know how hard it is, how much pressure you guys have on you, both from the public, the business side, you know, the state, the county, the whole 9 yards. It's not an easy job, but it can be rewarding at the end of the day once you can actually take a step back and look at what you guys have done as a whole. So let's go ahead and jump in. Oh, sorry. That's my next presentation.
Well, you said you were going to jump around.
Yeah.
I am. I didn't think I was going to jump around that quickly. Okay. So the first thing that I want to talk about is how do we fit into that structure of the response structure. You know, we've all taken those courses of ICS, but you know, what does this mean to us? How does this structure work? And so that's what we're going to be getting into. And the first thing that, you know, everybody expects, you know, especially, you know, if you were back in here in 04 or 05, is the government's going to come in and take over everything. That's not how it works. You guys at the local levels are the ones in charge of that emergency. We at the state or the feds are there to support your guys' response. If you guys need to turn it over to somebody, you can, but you guys are the ones that are in charge. You guys know your community, you know what's going on, you know what would be, you know, best for it, you know what your resources are, what resources you guys may need, you know, so you guys are the ones that are in charge, you guys are running it. And the other thing that I know a lot of people don't believe is that disasters don't affect just the government, it affects the whole community. So when you do planning, you got to plan with the whole community to be involved. You need your businesses. One of the things during 04 and 05, we passed out a lot of ice and water. Trailers got down there faster than people did. And so what did we do? We passed that out because everybody needs ice and water. And then all of a sudden we were told, hey, we need a FEMA person on site before we could start doing that. So then it just sat in trucks, so it wasn't being able to be pushed out. But then we thought about it too. If Publix or Walmart or whatever grocery store you guys go to is open down the road, do we really need to be bringing in ice and water? Do we need to use government funds to do something that's already there? And that's kind of a waste of funds to be able to recover from a disaster. You want to put those funds where it's most useful. So when you start planning these things, plan with your partners that you have out there, your businesses out there, because if a Publix or somebody, and I'll just, you know, that's just a place I throw out there, it's not because I'm for them or anything, but you know, they have generators. I also found out apparently most publics also have satellite phones, that if you need something, you may be able to just walk into that and say, hey, can I borrow this? FDA and USDA will go in and use their phones from time to time if need to be. So, knowing that these resources are out there and available, that's half the battle. You don't need to necessarily have the answer, you just may need to know where can I find the answer, or who do I need to ask, or who can I direct them to, And that's, and again, we'll be talking about this, how to use this structure to help do what you need to do, communicate with everybody so you can keep moving on and doing what you need to do, but everyone that needs to know things can. According to our state EOC reviews this document, the feds come out and say, there's a big circle, kind of a pie chart type thing about a whole bunch of different disasters. Then each state will take that and look and kind of figure out which ones are going to be most harm to us. Like, they list tsunamis as one of the risks. Well, here in Florida, I don't know the last time a tsunami has hit us. So we, they cut out all those things that may not be a big deal to us. And when you go through this list, radiological, hazardous material, transportation accidents, flooding, storms, droughts, that how many of these things could have a role that EH plays in? And a lot of these things do. So we have to look at all these different situations and say, hey, how does what do we need to plan for? What kind of issues can we have? I know we already talked about flooding with septic issues, well issues, mold issues. You have all these different types of things that could be going on. And so we had a percentage up here. I have to go back and try to figure out if, how close that percentage was. But, we do have a number of these issues that do go through that environmental health would have some kind of a role in resolving if this stuff occurs. So we have all these moving parts, and so we all have to be integrated into a response structure. And so, because if we did one thing, and well, just think about your health department. If EH did one thing, and your nursing section did another thing, and your IT did another thing, or planning did another thing, you may be duplicating efforts, or you may not be able to hit certain things because you don't have the time. So you need to be coordinating not only within yourself, but coordinating with both with the local, state, and federal governments. And the big thing to also know is during these blue skies is know what their roles are. Know who inspects what. Know what capability somebody has. One of the issues we've had in preparedness is buying thermometers for our EA strike teams, because preparedness looks at that as something we should have as an everyday thing. I just had a meeting with not USDA, the FDACs and hotels and restaurants. They can buy thermometers for preparedness all day long. So they're going to buy that stuff and give it to us. They can't buy bug spray. Bug spray is something we can do, and we'll give it back to them. So we're going to be sharing resources that they can pass through their stuff, we can pass through our stuff, but as a state, we're better prepared for what we need to do. And that's what you need to do, is just communicate, ask questions. The worst thing someone's going to say is, no, I can't do that, but at least now you know, and you can start figuring out who can, or who is willing to, or has the ability to do those things. And so that's why you got to coordinate with your other groups now, so that you're prepared when need be. And like I've been kind of saying this whole time, everything starts locally. The locals have their, their agreements within their county. They have their agreements with the regional size. Once that starts getting overwhelmed, then it moves up to the state. Once the state gets overwhelmed, then it goes up to the federal government and interagency agreement. Hence, we've already been seeing Texas requesting extra resources for Harvey right now, is so that they're already expecting to be overwhelmed, and they need to get those people in place ready to go. So, to make it official, we have Florida Statute 252 that explains our response structure that we have here in Florida. and how we plan is going to be consistent with the state and the federal and state emergency management principles, and we use the ICS, the incident command structure. How many people have taken all ICS, like 100, 200 type classes? Yeah. So you guys know that there's an incident commander, and then under there you have your operations, planning, logistics, and financial sections. Now, does every emergency have all these parts? Well, they may have all these parts, but they may not have individual people in those parts. You may have, your incident commander may be all of the above, because if it's small enough that one person can handle, then that's all you need. But the nice thing about the structure of the system is it's flexible. It can expand and shrink as needed depending on what the need is and where you need to go and what's going on. So the incident commander is the one who basically drives the decision making and the direction that that response needs to go into. They could be the first person on the scene, and until a transfer is made, maybe they end up being the only one, the one that's the best person for that job. You may find out that, hey, a food inspector just found a septic issue and we need to give this to somebody else. And so that's, that's like internal, or you may have a problem at a restaurant, you got to switch agencies or whatever you need to do. But usually the first one on the scene is the person until, you get the proper people that need to be out there. And then, like I said, and this kind of goes with any spot, is they may fill as many roles as needed until that event says we need more people. Your operations section is basically what most of you guys are, is you're the boots on the ground. Now, we also have roles in planning and logistics and stuff like that, but the operations is whatever the incident commander says we need to do this, the operations section is the one that goes and gets that done. The planning section is the one who says, okay, we need to do this, how do we do it, what's our plan of attack, so that way the operations people can go and say, okay, these are all the things we need to do, these are the resources we're going to get, and be able to go do it. And they gather intelligence, they look at situation reports, they look at mapping, the weather. You don't want to be going out in the middle of a thunderstorm trying to dig a hole with 6-foot rod and thunder going around. That's not very safe to do. So you got to pay attention to, before you go rush out and do something, look at what's going on around you. Logistics. Basically, they're the ones who get the resources out to where they need to go. They look at what resources they have, what do they need to order, and they're the ones who are just kind of moving resources. Now, do you guys know what resources are?
Water, ice.
But they're also people.
Equipment.
They're both sides of things, and we're going to talk about how to request stuff through ESF-8 for the state of Florida. Now, I will not say that this is the way you do it for all the ESFs, but I'm only going to talk about, since I'm in ESF-8, that's the one I'm going to be explaining, so you guys at the counties know what to do in case you ever need something. They also established the field operation centers, the forward operating bases, the logistics staging areas, base camps, and they also coordinate the in-state mutual aid and emergency management assistance pack, the EMAC, which is exactly what Texas has done. We've started getting EMAC requests, and that's what it's being done through. So that's what that system is, and that's kind of how it works. Is we use our internal system, which we'll be talking about shortly. EMAC is to go outside of our state, and that's how we ended up going up to Iowa too, was through an EMAC request. Then you have the administration section, and at the end of the day, everything costs money. You have to track the money you spend, because everybody, if a disaster happens, you want to kind of get that reimbursement from FEMA. FEMA, just like every government agency, they need the documentation to prove that all this stuff really occurred, and how much money you really did spend, but you also need that budget person who says, you know, we could do it this way, but what about this way? Can we do it this way? It'd be cheaper. Can you guys still be able to do your job? So, you know, they got to look at it from all sides of things, and that's what this section is. And like, you know, like every other section, I mean, it's very critical. Again, like I said, money is the bottom line. So our state emergency response team, table of organization, of course, starts with our governor. Then it goes to people at our state EOC, and it breaks down into the different sections. And down below, we actually list these different emergency support functions. How many people knew that we have 18 of them now? That's good, we had a couple people. How many people can name all 18?
You, maybe?
I can't. That's why I have the next slide that shows me all these things, but still. But you know, but the last, you know, well, one of the last ones deals is with actually the businesses. You know, so that's one of the things that were added because again, if they're back up and running, if we can help them, that just kind of takes a load off of us to do, you know, like one aspect, and we can move on to other things. How many people can name one?
Health and medical.
There you go, thank you. Since I already said that. So, to go through them, we have, I'm not going to, these are emergency support functions. I went 1 to 18. The first one is transportation, communications, public works, firefighting, and plans. And then next to them is the lead agency. So you'll see some of these like food and water. You know, how many agencies in Florida regulate food?
5.
6, you're correct. Plus the FDA that comes in too. So if you want to count that, then you know we kind of have 7. But we actually have 6 agencies that regulate food in some aspect. So there's clearly an overlap of things. But there's one agency that has been designated the lead, and then there's the support ones. Yes, for 6 we have mass care, then we have resource management, public health and medical, search and rescue, hazardous materials, and environmental protection. And some of these things, you know, that one agency may have different ESFs that they also are in charge of too. Luckily for us, ESF 8 is the only lead for us, but pretty soon I'll show you how many we support. ESF 11 is the food and water. Then we have energy, military support, external affairs, volunteer and donations, law enforcement and security, animal and agriculture uses, and then business, industry, and economic stability. So those are all the ESFs that can be called in. Now, not every storm requires all of these, and there may be a partial activation. But of course, if a big storm hits, they're all going to be activated, ready to go, and support as needed. So, we're the lead on ESF 8. There are 23 agencies that, agencies and organizations that actually support us. We'll be going through those next. But we support 8 other ones, and I've actually underlined 2 for a reason. So the ones we support is Public Works and Engineering, Mass Care, Environmental Protection, Food and Water, Energy, External Affairs, and Law Enforcement and Animal and Agriculture issues. The 2 I have underlined are not ones that they actually list us as a supporting agency, but they use us. And we're listed as like some rules and stuff. Law Enforcement and Security. Can anybody think how we would have a role with them?
If you're trying to get emergency help through for the medical part.
Well, would that be kind of like if a shelter opening up and you need them? They would be supporting us. We really wouldn't be supporting them. That is actually just because.
I would say bioterrorism.
Well, because we can quarantine people.
Yeah.
Is so we have the rule of doing that. They use our rule if they need to. So we're not there to really do anything except if they need to quarantine people, they ask us to, hey, can you do this? And so we're supporting in that fashion. We're not physically doing something. Now, mass care is kind of, you know, it's a strange one, because when you think mass care, what are you thinking of during emergencies? Sheltering, you know, and so you know, how many health departments have said, I mean, how many people here said, I've worked at a special needs shelter? But we actually aren't listed as a support agency for that one. Again, we are doing things because we're supporting another aspect, you know, another agency that's doing the sheltering and stuff like that. This would be a great time to talk about this. Special needs shelters. How many people have read the rule about special needs shelters? Does it say the health department will man special needs shelters? No, what does the rule say? It says we will make sure that a special needs shelter is manned. It doesn't say we will man it.
Right.
But do you think we will, how many, will all counties, let me put it this way, will all counties be able to get those people, those volunteers from businesses, those nurses and stuff, go away from their work and volunteer to work at a special needs shelter? It's going to be practically impossible when you're in rural counties to do stuff. So it's a lot of the times the administrators will just say, we'll just go ahead and do it, and that way we're done, we're covered, we have no issues. But again, at the same time, when you're doing that in your small county, that takes away from a lot of other things that you should or could be doing, let me put it that way.
And it's getting harder and harder for us to do that in the small rural counties because we don't have the staff anymore.
Correct.
We don't do primary care.
Correct. And so, and then let me ask you this question. For those that are in EH, how many people have been asked to do a pre-shelter opening, a survey? Okay. What form are you supposed to use?
There was one out there, I found it in your book.
Well, my guy?
Your guy.
Must have been one of my older ones. But anyways.
I found a form somewhere.
Well, there are actually 3 forms, completely different forms out there, but which one are you supposed to use? The rule is whatever the county decides that they want to use. There is not and it's really up to the county to decide what actually they should be looking at too. You know, it says that, like you'll do an inspection, and you being the general you, not EH. EH usually, because you're ready to do facility inspections, they say, hey, you're with the health department, go do this. You're not a building inspector, you're not, but you go in, you can look and you can tell, from the kind of the outside type of things, like if there's any issues that you see. But all these things are made up, have to be discussed with the county. Is what does the county want us to be looking at? What does the county, the nice thing, a lot of the times it's at a school. A school has its own maintenance group that if there's issues they can deal with. It's county owned and operated. That these things are pretty easy to get fixed and go do, especially during an emergency. They have a little bit, quicker to move, and have the money to do those things. But it's really up to the county in terms of what they should be looking at. Now we have a CDC shelter form that we point to people to. We have the EH assessment form, which we'll be talking about, that we point people to. And actually the ESFA, Bureau of Preparedness, has a shelter form that they've made up that you can use. They're all to different degrees of usefulness, and they all have some bad things. The bad things about, like in the EH assessment form, is they talked about a whole bunch of things like mobile home parks. You're probably not at a mobile home park if you're at a special needs shelter. And so there's parts of that form that aren't going to be useful to it. There's things in the CDC that goes into this great amount of detail that maybe you don't even want to have to deal with half these things. Maybe there isn't a kitchen in the facility that you need to look at. And then the form that that Preparedness made up is a very general form. It says room 1, what does it look like? Room 2, what does it look like? Room 3. It doesn't go into any kind of detail about maybe what you should be looking for. So have that conversation, like when hurricanes or storms aren't hitting you, and say, hey, what do we want to look at? What kind of form do we want to generate? And this is what we're going to use, and figure out who the best person to do that assessment is. Maybe it is the building inspector. Maybe it is you guys. Maybe it's a joint inspection between you and someone from the county. Go ahead and have those conversations when you don't have a storm hitting you, and to start moving forward. So agencies that help us out to do all the things that we're asked to do for ESF8. You have ACA, agencies of persons with disabilities, elder affairs, children and families, ads, hotel and restaurants, environmental protection, veterans affairs, fire marshal. You can read all this. We have laboratories, the Assisted Living Facility Association, poison control, Red Cross. So you have all these people who have some kind of a role to help us do all the things we need to do. So again, a disaster, whether it's man-made, is managed at the local level. So you need to, let's talk about you, because you're going to be the ones out there doing the work. First and foremost, know your limitations. Don't do it if you can. Don't do it for someone else. And don't do it without taking care of yourself and your family. If your house is destroyed and your mind is on your house and all the things you have to do, are you going to be useful out in the field trying to help somebody else? Are you going to be, those are the times that you may not be the safest because your mind is somewhere else. And during the times of emergencies, you may have driven down a road 100 times, 1,000,000 times during the last 20 years doing your job. A hole may appear that wasn't there before. A puddle may be there that you don't know how deep it is because you're not quite thinking. So make sure you are in a good state of mind before you go and respond. And one way you can make sure your family is safe is you can either make an online plan at the floridadisaster.org, which is the Department of Emergency Management's webpage. Get a plan. It'll ask you relatively, there's actually just 4 pages of information you fill out. It's very simple. Basically, what's your information? Do you have family and kids? Do you have a meeting place? Who's your contact for in-state? Who's your contact for out-of-state? Do you have pets? Do you have something else? It's very simple. It doesn't go into great detail, but at least it starts getting you moving into thinking about what do I have to do, what should I plan for. They also have printed out guides that you can either print out or get to help you plan for stuff, and they come in different languages. One of the stories I always tell people, and I know Wes has already heard this story, is during Tropical Storm Debbie, the road to the health department was flooded. And we had probably about 3 or 4 feet of water on that road right in front of the health department. Luckily, the health department was up on a hill, so no water got inside that from the road. But it was just this little 2-lane road that the health department was on. And a van ended up getting off the road and kind of into the woods a little bit. And in this van was a whole bunch of brand new equipment that a contractor had just bought. And that stuff is not cheap. So it was just starting to rain. He thought he'd be able to get to it. Well, it kept raining and raining and raining, and pretty soon the water was to the top of the van. So he decided that he needed to go in and get all his equipment so he didn't lose any of that stuff. So he goes walking down and starts, getting to his van. Somehow, some cops that must have been just driving around saw this guy going into this floodwater. And so what do? The first guy jumps out of there and starts running into the water to stop this guy from doing this. Well, neither of these people apparently knew how to swim. And we almost lost, not only was the guy that was trying to pull this stuff out, but the cop who jumped in trying to pull this guy out didn't know how to swim either. And he almost drowned. Luckily, the third cop, he didn't get into the water, but he was able to rescue them and get them out without losing any lives. No one was any seriously injured. But again, know your limitations before you go do something. Yes, I understand, the first instinct is to go help. But make sure you know your limitations. Make sure you know what you can do. Yes, sir.
Interesting point. Those of us that work for state, local governments, do our respective agencies understand that if my house gets blown down, I can't serve? under those circumstances?
Well, I mean, most people, I mean, I know during Debbie, we had a number of people that didn't come in for over a week because they were dealing with stuff at their own house. I mean, you know, it is kind of a fine line between what your role is and, you know, if you're a large enough agency, you know, most people can survive a day or two and get resources to come in to fill your position as need to be. You know, sometimes you can work from home depending on how that is. So, I mean, that all has to be kind of figured out locally. But at the same time, I think most people understand emergencies happen all the time. Even when during blue skies, something could happen to you. A tree can fall on your house, and you may be out for a couple days. You know, I know my wife always says, you know, your job's going to be there tomorrow, even if you're not. You know, that you got to take care of yourself. I mean, that's why we have sick leave and annual leave and all that built in. So this is the time to make sure you kind of understand. You know, you can ask those questions to upper management and say, hey, if this happens to us, what is our plan? What can we do? You know, because and from your, you know, from that side, you almost look like you're a good employee because you're trying to plan for these things, but at the same time, you're also kind of building in that safety net to make sure that if something happens, that you can have that break. But you know, the farther up the chain you are, you know, technically, you know, the more important you are. But that's why we also have a 3D structure in most cases. We, you know, your administrator has people that if they're on leave, then they have people who fill in for you. And the same thing should be going for your positions also. Does that make sense?
Yeah, it makes perfect sense, and it's logical. The problem is, not all people in high places are necessarily logical or respectful of other people's needs. You know, and I've worked for agencies where they were, and I've worked for agencies where they absolutely weren't, even though they said they were.
Yeah.
So that's why I'm saying, is it enshrined in some code somewhere that if you can't serve because of, you know, a family crisis, because your house got destroyed, or one of your significant others was, you know, somehow harmed by this event, is there something written somewhere that says they can't force you to do it and then fire you because you didn't do it?
To answer your question straightforward, I don't know of that, but I know that's been preached to us for a long time. So I can go back and find out if there really is something somewhere. I mean, I know one of the things we're working on is a responder safety and health type of thing. You know, that, you know, just because you've been deployed to someplace and you come home doesn't mean you can't have still emotional issues for a year after, you know, afterwards, that, you know, you should be, you know, Sandy Hook, you know, that was a shooting up in Connecticut. And do you know how many police officers are working today that were the first responders that showed up there? 0. Not a single one, because of the emotional trauma that it took, you know, on them the day they showed up and they were dealing with that. So you know, so there is that, and I don't know if it's going to be kind of built into that in terms of, you know, you need to be taking care of your home life. So I'll see if that's going to get worked into that procedure, because I think that if it's not anywhere, that may be one of the best places to put it. So let me find out.
You know, I ask this question in all sincerity because as a government employee, I believe it's my duty, you know, and that's one of the reasons I work for state government. I believe it's my duty to help. But there are times when you can't, and that's the only thing that, you know.
Yeah, no, and you know, like most of us, you know, just like I said, most of us are in this job not because we absolutely love being yelled at by contractors all day long. You know, we're in this job because we feel like we can help and we want to make a difference in somebody's life. You know, that's why we do this job. But we're all human. We all have things that we need to take care of ourselves. So, so it is a very good point. But like I said, straightforward. I don't know of it necessarily written somewhere. I mean, it almost would. Like I said, it'd be logical, but we'll find out. We'll need to see if it's actually there. And one other thing I'd like to say about, you know, taking care of yourself, that it'll show that I'm human also. is Tropical Storm Debbie hit us, and we had all this rain. I was running around like crazy. I mean, basically, we had sent all our staff home. We had to get the special needs shelter set up. The EOC was activated. Our administrator was out in St. John's, I think, at the time. So they were trying to come back. I was trying to give her directions on how to get to the EOC safely, that she wasn't running into water. So we were just doing all this running around. I was working, you know, about 16 hours a day for about, I don't know, 3-4 weeks straight. We had a strike team that came in. I was driving home one day, and I was in a large SUV. I thought I was going to be perfectly fine. Water got into that engine and killed the car, and it was a state vehicle, you know, county vehicle, and they had to do a whole replacement of that car. You need to make sure that you take breaks. You need to make sure that you're going to be safe out there. Luckily, nothing happened to me. Luckily, FEMA was giving us money to replace these things. The county already had, I think it was 25 other police cars that had the same issue happen to them as they were driving around. So it wasn't just like something, an isolated thing that I did. But still, you need to make sure that you're safe. You know, you hear people preach all the time, you know, turn around, don't drown. You know, the same thing goes. You know, it doesn't take that much water to move the vehicle. It doesn't take that much moving water to move yourself. Just, you know, make sure if you're going someplace, even if you're going home, make sure you're going to be safe. Make sure you're going to be in good mind and rested. So for you, you need to know, how do you fit into that structure? You know, are you someone down low that are going out, the boots on the ground, doing the work that your EH director is asking you to do? Are you the EH director? Are you the administrator? Where's your role? Now, is your supervisor day-to-day the same supervisor you may have during an emergency? That's correct. Because the person that's going to be in that supervisor role is the best person for that job. If you have like a pool issue, let's say for some reason all the pools in your county start becoming contaminated, and you know, you may have your administrator, but maybe you have someone over with the water section that may deal with those things on a more daily basis. They may be the lead for this, just for the fact that that's what they may have a little bit more training, more specific training that would help them out in the situation. So just because someone's your supervisor day to day may not be that case during an emergency. Now, at the same time, you also have DOH policies, and you still need approvals from your emergency, you know, your supervisor and everything to be deployed and all that. You know, so you kind of have to have that two mindset. But during an emergency, you're going to have a person that you are going to respond to, and how you do request is up through that system. You don't kind of go rogue and do your own thing, because if you go rogue, you may miss somebody, some agency that may need some information that may not hear about it. So use the structure, and the structure can help you out in the long run. And we'll be talking about here pretty soon about how to do a request through the local EOC and how we get it up at the state. And then us in the Bureau of Environmental Health can advise and support you. Like if you have a question, you know, even it could be a small sinkhole that opens up in a neighborhood. You know, if you need help, that's what we're there for. And you know, just because the state EOC doesn't activate doesn't mean we won't, you know, support and do all that stuff. It doesn't matter if it's, you know, blue skies or gray skies. That's what we're there for, to help you guys out. So here's the state EOC. And you see we have nice glass on the outside of our EOC. The person who designed it, who built this, wanted to match the surrounding buildings. They all look like this, so they all had to do that. But internally, we have a wall that will support us from a hurricane. I don't know what category hurricane, but we have an internal wall that will then protect us on the inside. But we have, but they wanted the outside to look like that, so that's why we have windows on the outside of our EOC. So these are pictures from the inside. So this is where the incident commander stands. They have a whole bunch of screens up here that are showing like current information. They go ahead and talk. Back on this backside is where ESF 8 sits. And you see that it's all open. The old ways used to have big walls there, and it was hard to see who was where. they've knocked that all down. The bad thing is without any walls, it's very easy to hear conversations from across the place. But we have this small little room back here that we're working on redoing to kind of, because we used to have like 8 computer stands on the outside, but it wasn't a good place to have a conversation on the inside, so they put like they took all that out and put a big table in the middle so we can have an open conversation with us and our partners. And this is just a picture of where we sit from ESF8 looking up at the main screen. Back behind here, a couple of the, well, if you're an EH director, you'll sometimes get emails from your rear or from me about messages from the state warning point or state watch office. This is the room that they sit in, and you need to have a special badge to get in there. They have a ton of computer. I think they have like 8 TV screens up going on the different news stations, so that way they hear about anything that goes on. They have computers set up all over the places. They have multiple lines to come into them for phone calls, and that's where they capture all the information and send it out to us. Back over on this side is where a PIO room is, so that way if the media wants to come in, they can come in. It's one place you can ask your questions, you can have your conversation. You can either turn on the volume from the main room here so they can hear what like the incident reports are, what's going on and all that stuff, but then they can shut off the volume too if they're going to have more specific conversations that they don't want the media to hear. But it's a room that they have set up just for the media if they need to. Back on this side is where like all the legal people are, and on the side you see over there, that's where like the GIS people sit. And we're all set up into our sections like fire rescue, us, kind of all health and medical, fire rescue. The operations are in one section, planning is in another, and that's how they set up all the ESFs in the state EOC. So, communications with your EOC activated. Know your contacts, know how to get a message to your EOC, know who your liaison, who's going to be sitting at your ESF desk. A lot of times it may be one of your EH directors, it may be the administrator, maybe a planning person, but just know who is the person that's going to be sitting over there. Know your systems. Some counties use web EOCs. Some counties use EM constellations. Pretty soon we're all going to be moving to web EOC, but right now it's kind of a mixture. Most counties are using web EOC, but again, not necessarily know the system so you can put it in, but just know what's going to be asked of you. So that way if you get a request, you can get them the information correctly the first time. Serve Florida. Know who your managers are. Make sure your information is up to date. Florida Health Stat used to be called EM Resources. It's a new name, new system, but it basically does the same thing. So just know what the current systems that are being used are. And then EM Constellations. Here's a shot of EM Constellations. This is what the state EOC uses. So if there's a request that gets put in at the county, this is how the messaging comes up here. Another good thing about EM Constellations, this is where you sometimes just put situation reports. You put just general information of your county. This is a great way when you have a disaster and you need to document what happened. You put it into this system, and it's a one-shop all for everything you've done. All the resources you requested, all the information you requested, whatever information you kind of want to put in there from the county, you can go in here. And again, then it's all under one, disaster, and you can look back when it comes to those times. Okay, can we prove that we did this, or how much time did this really take? And you can go and do this. And so that way, when you put in a request, don't close it as soon as you get your piece of paper you need if there's still something else tied with it. Let's say you request an EH strike team and the EH strike team is out on site. Don't close it because they're still out there and you want to track their time that they spent, because you still have to, someone's still paying their salary. You want to go ahead and track it. The other thing is like for resources that you need. If that resource is going to go from team to team, don't shut it down, because then you'd have to re-request it even though it's already there. Just keep that open until you are done with it, so that way you can truly track how long that equipment was needed, where was it done, just put all that stuff in here, and it's a good kind of a one-shop all for saving that stuff. So this is one of the changes we did in our EH guide. I actually went into EM Constellations and looked at the different boxes that were being requested. One of the things we actually did in Bay County, we did an exercise out there, and they, we always say you lose phone and internet, but how much practice do you really do, or how much, thought really goes into that? You just kind of move on, and 2 hours later it all comes back and everything's great. What Bay County did was they used their ham radio guys and filled out a form. It wasn't this form, it was the old form, but they still filled out a form, and they sent that up to the state EOC, who then received it through the radio system. They were then able, up at the EOC, technically put that request into EM Constellations and sent the note back that it was put in, gave it its tracking number and other information. And so even without phone and internet, the county was still able to request resources to get for it. And they requested mosquito pellets for this one, just as a practice. And so just because you don't have phone or internet, having this form, knowing what needs to be filled out, or even if you do have that stuff, knowing what the person who's putting it in would like to make sure that the request is as complete as possible, this is kind of a great place to look at and say and this also kind of helps you with planning aspect. How long are you going to need that resource for? What are the different things you need? We have some filled out already in our EH guide that will break it down like an EH strike team. What do you exactly need out of that EH strike team? Do you need food people, septic people, mobile home people, water sampling? What do you need? And you mark exactly what you need, so that way when you send the request up to us, then we at the state can look and say, we have 5 volunteers, but actually only 3 match what they need. These are the 3 we want to send. We just want to send bodies just to send bodies. We want to send people that you need. And another thing to point out is you have both, you have a primary and secondary contact name. It is possible you send up a request, and it may take 8 hours for that request to probably be seen by ESF 8. And by that time you may have had a shift in person. You may have 2 shifts in people, before someone looks at it. Make sure you have multiple contact people, so that way we're not bugging someone who finally just got off and is dead tired and needs a break. We know we can get a name of somebody who's working and can tell us what the current situation is and what we need to do. So we need those multiple contact things, or people. And then an on-scene contact. So I took it off the slide, so I need to change the slide. But but we're there for resources. What kind of resources do we have? And one of the things that we have is we have toolkits. We have toolkits that are both good for the inspector, and we have toolkits that are good for the public. And we have toolkits that actually can be used for both. We have septic ones that you have a homeowner has a septic system. What should they be thinking of? What should they be paying attention to? Should you pump a septic system out when the grounds around there is flooded? No. Well, if you do, make sure you put water back in there, because you don't want to cause other harm. So if you absolutely have to, but it really isn't going to do much. But we have some good information that's out there, both on our external and SharePoint site of things. So we have something like that. We have a whole bunch of press releases that we have. One of the toolkits we actually have 3 for mobile home parks. We have 1 for owners, we have 1 for residents, and we have 1 for an inspector. So we do break them down sometimes by the specific needs of the different groups. We also have, and I'll open that other one up in 1 second. One of the things that we have bought for strike team people, strike teams, is we've bought so far like office supply. But these are good things that you can go around your health department and just look and pick up some pens, paper, stuff like that, and stash them away for an emergency, that you have a small little kit you can use. We have sanitary wipes. We have different size markers. And if you order something, make sure you have the way to sharpen, to reuse, stuff like that. Don't just think of, and we have a tape dispenser. Make sure you have extra tape. Sometimes when you buy tape, it just comes in the roll, so make sure you have the dispenser that goes with it. If you have a stapler, make sure you have extra staples and a staple puller in case you need it. So don't just kind of think of the basics, but we have, like I said, this stuff for strike team people. We're also working on buying lights and lanterns and a car kit, you know, for emergency. You know, we're working on getting something like a jumper, you know, be able to jump a battery, but also an air compressor to blow up those tires. Because how many times have you gone down a road, especially after like a tornado or a hurricane, and there's nails in the middle of the road that you can get small little things. Now, yeah, they have to be fixed correctly, but you know, get something to be able to get the person back home, so that way we can do the next thing. We have satellite phones that that people can request. The nice thing about satellite phones are technically they don't have to be activated at this time. We're not paying for this phone right now for a service, but we do then have to just call and activate it. You do also have to make sure that satellite phones or your radios or stuff like that, the batteries are charged, because how good is it just sitting here in the case, ready to use when you don't have it charged and then you don't have electricity to go charge it. So, you know, you want to be thinking about these types of things, but again, we have a whole bunch of stuff. You know, if you need something, you request it and explain what you need things for. You know, we have jumper cables, and then we have extra sampling kits. If you need something, ask for it. Again, the worst thing is we may not have it at that second, but we have a list of vendors that we can go through. We'll be talking about this shortly with sand packs. You know, you guys have your own local septic companies that may do porta potties, but then we have one vendor that's nationwide that we can get stuff to you. So again, ask for it, explain what you need so we can get you the equipment you need, because you never know if either us or, like I said, Department of Ag or somebody else may have the stuff that we can get it to you quickly, and then we'll deal with the reimbursement and replacing as need to be. But this last kit so how many people have received these at the county?
Yep.
How many people have opened it up?
And they closed it.
So last year we sent away a biomedical waste spill kit, you know, because Ebola was the big issue at the time. We have gloves in there. We have different, you know, tongs. At the state, we actually have a whole bunch of puncture-resistant gloves that we can get down to you guys. We have different size containers in here that if you have to go clean something up, that we have extra stuff of. You know, we have grabbers. We have the powder that you can pour down and you can sweep up. But the other thing we have is we have, I don't know if it's official yet, but we're working on getting like a third warehouse in the state for ESFA. Do you guys know where our first two are?
Tallahassee?
Tallahassee's one. Do you know where the other place is? Orlando. And we're working on getting one down, I think in Lee County, but I'm not sure, but somewhere. But we actually have a whole bunch of extra of this stuff sitting in both Leon and in Orange. We have more in Orange than in Leon, just because Orange is kind of covering a bigger area right now. But we have extra stuff of this that during an emergency, if you need it, ask it, and it can be at your doorsteps pretty quickly because it's already paid for. It's just sitting there ready to use. Now, a couple of this stuff is also, you know, can be used for other things besides just biomedical waste. So we have it set up so it's not really in any of these specific kits, but again, the equipment is there that if you need it, ask for it, and ask for specifically what you need, and we can get that stuff to you guys. So again, you know, we have stuff at the state, and there is a system that preparedness has been pushing, trying to get all your, you know, all your supplies in there, so that way if a region needs something, you know, it's a one-stop place off. And we have that all in that system, and the name will come to me in a second, but, you know, so you can look to see, and you can see what's there at the warehouses, and, you know, so if you need something, it's a great place to start to request stuff.
Excuse me, Mike, we have two of them. Can we request one for each staff? In Palm Beach.
We have 10 for strike teams that are sitting up in the warehouses.
We have one.
But we only sent one county, except for like a couple counties got two based off the amount of stuff they did.
Correct.
If we get any more money, I'll let you guys know, and we can work on getting some more out there. One thing, and this is something that you guys can do at the county level too, is so preparedness has this funds that they get from the CDC that pays for a lot of the county planners. One of the things that they have is this called the one-time funding projects. And they have set, and I don't hold me to an exact amount, but they set a portion of that off to the side. That one thing you can then do is put in a special project, like you would like, you know, an extra kid or 2 extra kids or something, and maybe we can then, you know, we can work on it that way. So, but I mean, you know, so if there's other ideas you guys have at the counties, the drinking water inspection kits, which I won't touch right now, you know, you can request these things too, you know, you know, through this and see what happens. But what else can you could, of course, you know, get strike teams, staff augmentation, you know, replacement. And you can get replacements for your directors too. They get tired just like everybody else, even though they're at a different pedestal. They do get tired, they do get worn down. They can go on vacation every now and then. So I mean, but you also need it for, you know, sometimes you need an extra staff assistant. You may not need like necessarily an person, but you may need some help behind the desk because all those phone calls, trying to make copies of things, you know, you can request things like that. Equipment, education materials, supplies. And there's actually other strike teams that are out there that you can request, you know, your special needs. Now, EPI is kind of being changed a little bit, so this is you know, it's not the strike team format, but they're working through their procedure because technically if there's, I mean, unless you have a huge event, typically maybe just 1 or 2 extra EPI people is all you need. You don't really need 8 people to come in and help out. So they're looking at their stuff, but they're still, you can still request help. The state is broken into 7 regions. We have leaders in each region. We have strike teams in each region. So it doesn't matter what part of the state gets hit. We can, you know, you can request help from other parts of the state to come in and help. So we can, you know, we can alert local staff of incidences that we learn about, like through the State Watch Office. We can provide consultation with subject matter experts, and we can provide language for fact sheets, press releases, and signage. So if you don't feel, if you're not 100% confident if what you got is correct, you can send it to us and we can review it for you and get it back to you guys. We work with the state PIO, the Office of Communications, so we're in communications with that, so we're getting that approval at the same time as we're writing this stuff to help kind of speed the process up if you need something. So, communications, if not, because again, sometimes the local that even the, you know, the local EOC may not be activated. So how do you have that contact? Because one of the nice things about the state EOC that I didn't say here is, you know, if you have an event and you saw the list of like DEP was in charge of ESF 10, you had DACs that are sitting at the EOC, that if you need to communicate something with them, you go through the chain of command and you can get to those other state agencies. And so you don't have to really be able to call these people constantly because, you know, you get to hold of somebody who can then trickle it down to their local inspector. You know, so use the state EOC to your advantage during this time to communicate with those other agencies. And so that's one thing that you don't have to worry about trying to get a hold of somebody, and remember to call them if they don't pick up the first time because you have 50 other things that are going on. But what do you do if the contact doesn't pick up or it's the weekend? So what's a way to contact another state agency if you can't get to them by phone or it's on the weekend and it seems like DEP hangs up their phone until Monday? But if this, through the State Watch Office. Right. The State Watch Office is manned 24 hours a day. How do you know how to contact the State Watch Office?
What is the State Watch Office?
Check my email.
The State Watch Office is it's the way the state has set up to keep communication going 24/7. They're a way that if you get a message to the State Watch Office, the State Watch Office can then turn around and contact another group, either both state, federal, or county. You know, they actually have the emails for your EM, your local emergency manager. They have contacts for maybe the local utility company. They have contacts for all the state agencies, you know, that have like, you know, an EFS, you know, ESF role. They have contacts for the feds. They have this stuff. So if you get a message to them, they can help communicate out. So if you have an issue that you need to get a hold of DEP, so when we get a sewage bill, it's kind of funny. It's like 80% of the emails are DEP people, then you have a whole bunch of county people, and then you have like 1 or 2 health department people that are put on there. And so, so the message gets out to all these different people, different regions, different things, that then trickle down to it. And if you send an email to your local RERA, if you send an email to me, hey, can you get this message to so-and-so? Even if it's during the day, we've had some counties call us and say, you know, we have, you know, the discoloration in this body water. And they were trying to get a hold of DEP and they weren't picking up. They tried to get a hold of Fish and Wildlife, they weren't picking up. They sent it up to the RERA with pictures. The RERA sent it up to our duty officer, who then sent it over to them. There's an email chain that the county just didn't sit on it because they were requesting it. And then we got the state watch office created a report and sent that out. So there was that email message that it got sent out to all these different requested agencies. So you have an email track of that communications did occur, and you didn't have to struggle trying to get a hold of these other agencies. So this is just one of the ways that, you know, and that's what they're set up for, is to communicate just, you know, with what other groups. The other thing is they can look at this and say, do we need the state activation? Because they'll review that, and that's the coming up here. You know, they look at the information too and see if they have to activate. So they may end up activating based off a phone call that comes in. So that helps speed that process up too.
So if you're just happening along and you see a tanker truck overturned and black goop going into a water body that you know is a drinking water source, you call the state watch office and you say, hey, I see this.
You can, yes. And they will then reach out and contact the other agencies, because that's what they do. And so you, in a single phone call, you kind of just then contacted however many agencies will need to be involved.
Same as a state warning point or something?
State warning point, state watch office, okay. The same place, okay. Just different person came in and said, we're going to call it this.
That's right, you know the point.
Yes. And so they actually have rollover numbers. So once you call one number, it'll keep rolling over to different numbers until someone picks up. So you don't have to worry about which number do I have to call, who's going to pick up. It's just a constant thing.
And what's the difference between the emergency and non-emergency numbers?
We get phone calls from homeowners about mold, and that's not an emergency, but they still want to make sure they find someone to get a hold of. And so they, you know, that's kind of a non-emergency. You have sewage going down or boil water notice. A boil water notice is an emergency situation.
I see.
Especially for mold, we have Tim Wallace's number. He's our contact for mold.
Well, he just left the room. So what happens if he's not there anymore?
So we should all put that phone number into our cell phones.
Well, like I said, if you also know your RERA, or or if you know your RERA's phone number, or you know my phone number, you know, all those ways will work for you. And this is, if you go to DEM website and search for the State Watch Office, they'll list all their phone numbers too. And if you go to different pages, they show you different numbers. It all gets to the same point. For some reason, they just list different rollover numbers on different pages, but it's all, like I said, it's all the same thing.
Get you into the system.
That's right. So the reports that are generated, this is a copy of an email. It shows it's a local incident, a wastewater release of a mere 100,000 gallons of raw sewage. That was a little bit close to a body water. It tells you, was it contained outside of a water reclamation plant? Were any surface waters affected? Any drinking waters affected? It's a very kind of detailed information of what the situation is. So you can kind of decide, is this a response that I actually need to go to, or is this something that I don't? Now, you know, this is technically, you know, a wastewater spill is in underneath DEP's rules. But from the health side of stuff, it's good to know that this stuff goes on. Make sure that the cleanup, that they're doing things the way they should be doing things. And so again, that's why we get it from the health, is just so we're aware and be prepared. Because again, in a couple of days, you may start having outbreaks around this area, and it's kind of be good to know that this happened. The other thing you can do, like if you're part of a state agency, is you can actually sign up for these daily incident reports. Now you can't get these just for your county. The report is the same for everyone who requests it, and it's for the whole state, and it talks about all the incidents that got called into the state watch office for that previous 24 hours time frame. This usually comes out between 7 and 8 in the morning, that you'll get an email and get a sum of this. The nice thing about this, and I've gotten a couple of requests from like EH directors that get this, is they see something that maybe they weren't aware of, because the state watch office maybe didn't notify us, to notify you. That it's good to go ahead and get this. Now, yes, you'll get the detailed report from us, the day before, but if you don't, and you want it, you can talk to your RERA, or you can talk to myself and say, hey, can you request this report from us? And usually within an hour, you can usually get that more detailed report, so you can see who a contact person is, what happened, and like I said, it gives you just a little bit more detail. Yes?
Can people in industry get that as well, or is it only for state employees?
I can't say yes for sure that people in the public can get this, but DEM has a review process. One of the issues is some of this data is sensitive information, and it can't be sent out to anyone, so I'm thinking the answer is probably no, but like I said, like anything, you can always ask and see what the answer is. They have, through their website, they shows you how to request it. I just know for sure if they see that it's a government email address, because that's one of the first things you give them, that it gets approved pretty quickly. One of the things that got called in the other day was a local EOC got hit by lightning and communications went down. 911 has been going down like in different counties. Luckily it's been transferred into other counties and it hasn't been dropped. But again, it's good to know this from the health department, some of these things, that even though this may not have a full role by us, but it's just kind of good county information to know what's going on. So this is what I was saying before, is they'll look at this information and figure out if more of an activation is needed and what type of activation is needed based off of these reports. And then if more activation is needed, then they can go ahead and start. Like I said, the state watch office is in the state EOC, but the people in charge of the state EOC gets notified of every single one that comes out. But again, if they need to activate, they're ready to go because they got the information and they can move as needed. So is there any questions on the structure?
I have a question. Do you want to give anyone a break or that thing?
That was actually going to be my next question. Is that normal for these things?
Okay.
Okay.
Unless you want an emergency.
Let's go take a 10-minute break.
You need to go sign in, please make sure you go up front and use the book and sign in, please. Right here. Right.
Do you need a pen?
I get stuff on an old daily basis. We talked about in addition to the I also report for your county. Well, actually, like he said, the daily report for every time. But he will notify as well as another a lot of this that's better than not getting. But yeah. I see those all the time.
Just showed up, smoke, getting infected in the south county of the
Well, what happens a lot of times is somebody will report it like you were talking about just a resident phone because they see water.
share your water.
Oh,
Yeah. Don't reach out to her.
So those are the notifications that.
Oh, do you?
The early that I get, and then if we're involved because there's something.
I want to tell you,
Yeah, we're not going to. That's in my email list every day.
So this year we're going to go procedures after we get approved. I'm hoping in about hoping in 2 weeks we'll kind of be able to put it on our website. We made a lot of changes to our press releases because before it came out more of like the state says this. We've changed it to more of the law because you guys have our contacts. You guys are the ones actually doing it. It's more for your county and everything. So that's what we're working through the process to get that from you guys would be a much better.
I think we had to include all the type those up and send out yeah, well, I'm gonna do
Everybody laughed, they just all me on this
so that they know. So I'm trying to reach out to next week, and I guess Region 3 is going to have a meeting process with the planners, so I may be coming out and the colors, I'll change that. Region 3 is going to the specific versions. The state is, the whole state is basically going to whoever's available this time. If they don't have the choice. Yes, yeah. So it's more, and that's kind of what we're trying to do. You know, Kindle's like 2 hours. So and with EH, how much money total staff so whoever's available at the time. Now, Iowa, most of us were from either regions 3 or 5. But when we went to Matthew, we were very good. We were over ones, you might have met 4 and 6. We had 4 together.
I mean, that was hard. We didn't have anybody to spare. Well,
thank you.
We have a person.
Yeah.
Started studying.
Oh, yes, okay. Scott's got to get some. Duval, sorry. Yeah, Duval.
Look, that's when you said that. That's why I laughed. Well, it's not really us because technically the DV's in charge. Yeah, we're.
No.
Yeah.
Big, you said your new officer. So that was
Besides the
That makes perfect sense.
oh, no.
I know, because I've been like doing stuff.
I didn't actually
I work for the state.
Oboe is.
Thank you.
For those that are
And then I left with done. So I just did my phone, I did send it I know.
Well, you know, and one of the things we're looking at is, one of the exercises in Region 1 is they're looking at an oil refinery that blows up. Now, the first aspect they're looking at is more of like a mass care type of thing. But then they would like to say, what would EH do? And my answer was, well, is there wells in there? Is there, basically is the, well, then if there's private wells in the area, then we have a role to test their water, because it's protecting the public, not looking at it because of the environment. So yeah.
Oh, okay. Oh, you do those inspections? Oh, you
Yes, yeah. No, that's good.
So we still have the word, we used to be called EPH before. EPH is for environmental. The EPH, it should be called the EPH, there is nothing on the public. We still have overlooking the word to the other. Now we can push it. Because it is something very
No, like I said, it's an excellent point. And I
you
think
also deal with the parks, like, or you deal with mostly stock when people trainers. Because we have a park, all these different point of distance.
yes, yeah.
Alright.
Yes. Now with that, usually like preparedness is the, EH locally may have the, they have some parts, but it's not really coming from our section. Preparedness, those are the ones who protect the EC. They're the ones who can get the people down there. But at the end of the day, it's not our rule, so it's not.
I supervise this, all this one.
It's a part of ESFA, but it's not a part of.
I just started.
Yeah, right. No, like I said, I mean, I dealt with that when I was in accounting, but I wasn't really taking this as part of environmental health. It was more part of,
Oh, yes.
ESFA.
Oh,
That's great, I love this girl so much.
So they would actually.
But again, is that environmental health?
I started,
So they gave us some cabin, so they can do it definitely. For us.
was offered a job as a deputy lead working for a ground.
Oh, gosh, that's fascinating.
They're gonna come in, they're gonna come in.
Since they were offering more money, I went to work for them and found out how awful it was.
Oh, it's awful, is it? Oh, that's disappointing.
Okay. No, I see it.
But you seem to have a lot of experience.
It's a time stretch job. So then I left and worked for Volusia County for 8 or 9 years.
Well, so
Oh, they can't get in.
you're talking about just Department of Health, right?
Still there. I know.
Okay, so we have,
guess because
so
I
the
didn't
Department of Health has a
Yeah,
preparedness, a bureau of preparedness and response. So if the state gets activated, they're the ones that fill these
She'll
roles
may have
at the
30 in
state
like
level.
April and May, and I'll have 30 in August.
So if they need, if the request comes in that deals with
And then we'll
environmental
decide
health,
whether we want to go
then it'll come into my section.
Yeah, she's here. This is the pool right now.
For the response, correct.
I told my daughter.
Yeah. So we have a surgeon general who technically is the one who controls things, but we have a emergency like coordinating officer who is the one that will actually oversee and then choose the active, will do whatever is requested. Does that make sense?
I think that's where we're going to.
Department of Health, right? Yes.
So Ms. Crumley, are you like the director of the Legionella?
Oh, no, I'm way down low.
I can justify the fact is we had one.
So this is kind of, I guess this is where like you're, no. Yeah, see, and I guess that goes back to the conversation, because, your blue sky versus your gray sky position. My blue sky, I'm in the Bureau of Environmental Health, and I'm just a trainer, so I don't really interact with the division person. But when there's an activation of the state, then the ESFA will activate my position to be able to coordinate information between the Bureau of Environmental Health and back to the EOC. Does that make sense?
Indoor air quality officials in the workshop in DC, like,
correct. Yeah, so I'm just a trainer that's within that bureau. But then when an activation happens, then I'm basically taking on lead to no, that I do not have.
She, her subject area is healthy
I don't have that.
Indoor air quality and she has databases of state laws regarding indoor air quality, tobacco
Because one of the things we're gonna start doing is putting a monitoring. Well, because they had nothing in Amarillo.
she's working on a report right now on indoor air quality in Ridley.
Renamed it 3 times.
Police
She asked
don't
me.
let it go. Police, the one
Well, I'm kind of joking about this too. I'm inside the government. I think it's hard for you guys just mention us trying to be in the middle of this, trying to figure out what's going on. I got a new boss, and she's like, so I need to know the structure of preparedness. And I said, well, during an emergency or during day-to-day operations? Are they the same? I'm like, no. She's like, can you give me both of these? I'm like, yeah, I'll get that to you. So no. Like I said, you don't have to act like it's just you, even though it's internally. And like, I don't know who else to talk to, on a day-to-day, basis. So, then there's the reorganization. And that takes forever to work for. And so, is it, do we follow the new structure? Do we follow the old structure? What do we do? So,
training on safety and so forth.
It does too. I won't say that's right, I'm just telling you that it's.
So she does a lot of training, she helps a lot of schools.
It's a sovereign nation,
Something to do.
As a name, environmental health team with 14 people. We do mosquito control and control, indoor air quality, food surveillance, food, health and safety.
Years ago.
Same here, you and I have interacted before when you were, yes. Well, I appreciate it.
Oh, wonderful. That's a separate.
That's right, yes.
Yeah, that's a separate section.
I was in both Swanee and Marion, and I remember, I think I interacted with a little bit more in Marion, probably a little bit more when I started in Swanee.
National Association.
Back then, I was
Mark was over there.
We were doing
There was,
Colorado.
I was trying to, so,
Have someone in DC.
there was a director who had been there for years, and she had left, and then they got a new director, and that's when I came.
But
Pamela Blackman was our, she started like 3 days before my interview.
Our representative just
Yeah, well, it's still kind of like that, but I think everybody's at the point where it's smooth, and that's not like they not doing it yet.
Facility inspections on schools and living facilities.
Did you work for the health department?
And this is just.
Right, exactly.
You remember this one?
Yeah, well,
No, I worked. Well, I asked Greg if he was coming, he said he could
Are you in Davie or you were in?
I'm in actually.
Oh, you're out
but
there.
I would be.
I'm not the expert.
Exactly.
Yeah, so basically you go
Some
out.
aspects were kind of that way.
We had 5 residents, so we
I heard next year they have all the pub sales, is that right?
He did. That's right. That's right. But
I've been out to that.
Why do they have the plan this far ahead?
Right.
For me, be working on a Saturday is great.
Right?
Yeah.
Sorry.
And I don't want that question, my wife went out and they decided to buy 10,000 acres of land down there. Would that then become a reservation and then become farming?
So yeah, that,
we can get close.
basically we have like 17 months that we have, until changes are going to occur. You got to do as much as you can during this time. So this is the first time for us.
No idea what's going on. That's interesting.
But in that light, we had to do some healthy homes, IQ training.
We took me out for tour
The properties. Income coming in from the casino.
Yeah.
They have a lot of properties, it's amazing. And they have a whole health department right there.
Right.
They do everything.
Right. Yeah, when we were doing the assessments, we were one of the counties that got visited when we were trying to do the accreditation. And that was a big point that they were trying to make, was some type of communication between the tribes and us, around, at least around our county, really through the state itself. The tribes have really wanted to kind of separate themselves because they've got all their partners through there. They don't need really, we give them the information and then they take it.
Well, so Cindy Dix is the division director.
Mike's just been working on a project on their Florida.
Emergency management section. That's kind of neat. Because they know it's a big topic.
Yeah, I was amazed about how much property they have in Broward and
So like I said, that's what we've been trying to push in big areas. But with the
and they've got a
position, it's just kind of been.
Yeah, I mean, do they?
Aside from the Hard Rock Cafe,
Well, is that
that's the
theirs?
one visible. Yes.
That's theirs.
Yeah.
They're really
Exactly.
of sovereignty there.
Right.
And
It
is
seems
that it?
So if they have foodborne illnesses, yes, we report to them that, we've been made aware of it, and how we deal with it.
Interesting.
Okay, that'd be wonderful.
Patrick is environmental
Okay, everybody.
my card. I can link you up to, we actually have an environmental resources department.
Hey guys, we're gonna go ahead and get started again.
I think we have
So this next part of the presentation I'm going to be talking about is our environmental health resource guide that we have. And there are a couple things in this slide that you won't see in our EH guide, and that's because our EH guide hasn't been published yet. And some of the stuff I just found out may be already getting expired, but still, this is what's going to be published at some point, someday. Soon. So, and this is where we can start kind of talking more about, you know, a response and what we need to do and how to do it. That's what it looks like. See, it's pretty and fancy and very plain.
Has the official logo.
That's right.
And the correct hand.
So, normally we say we update this every July 1, but I updated the slide. We'll update it eventually. It's posted, we have the current one that's out there is posted to our SharePoint site. We have grouped it by program area, and we contain checklist, contact information, tools, templates, and we don't have everything in the guide, but we kind of say this stuff is out there just to give you an idea of what's out there, so then you can start asking the questions, where is this specific thing if you need something. So we've broken it into the different sections of the Bureau of Environmental Health. We have the facility section, drinking water, wastewater, and then we have the other sections, I should probably move that up for next year, but the public health toxicology is now in the Bureau of Environmental Health. We also have Bureau of Radiation Control information, Bureau of EPI's, some of their information, planning for an EH response, working within the structure, and then we just have some regional maps that are good maps to know, so you know who your contacts are for maybe like a co-chair if you've got to go through that procedure, your RERAs, your regional environmental epidemiologist, because you know with so much turnover sometimes that changes. So, so we got maps on that. It just looks weird. This is actually a colored slide. I have no clue as why it's like this. But anyways, this is different areas in environmental health, water, food facilities, vector control, chemical issues, radiological issues, biomedical waste, and sanitation issues. You know, because everything has deals with like administration. You got to look at those the kind of the big problems that you may have. How many people have had communications issues during any kind of response? The only person that should not have raised her hand is her, because she's the only one who has not been part of one. That you always have those, and so you do exercises, you practice, and then things fail, and it doesn't always seem to get any better. But again, not knowing, just knowing what questions to ask, or being willing to ask questions can usually help stuff out. How many people know that DOH has 7 trailers that they can bring to different areas to help with communication issues? How many people know that if you have to shut down your health department because there's 6 feet of water in front of the road that leads to it, they can go bring a trailer set up so you can still connect to all your servers, get your phones connected without having to change numbers, and do all that usually within 72 hours. That's great. They don't want to be bothered. No. So we have these things and they're set up. So how many people were here when DOH passed out a whole bunch of little radios and said, this is what you're going to be using, and they were set up with 3 channels per county? How many people are using those right now? That's good, because we don't have licenses for any of those frequencies. So, but I'll tell you something about that too.
And that transmitter thing that we have to find every year and record somewhere, and nobody knows where it's at.
Or your county has moved it and no one knows where their codes are. But anyways, so so we have these ideas, but these are the radios that actually the trailers use to go ahead and get these, are one ways to communicate. What you can actually do through these trailers and these radios is you can call back to somebody who's sitting in an office, and they may not have a radio sitting at their desk, but you can send a message who will then send an email to that person, and they can then respond back to you. And so even though they don't have a radio, it's all been done through this trailer. So it's a way to communicate outside, if you're out of your office, and still communicate back. It's a way to communicate back with your EOC to go through this system. So if you have truly communication issues, there are solutions out there that you can use And one of the things, like I said early on with Bay County has used their EOC, their ham radio guys, and sent a form up to the state EOC. So they can do more than just talk back and forth nowadays. They can do a lot of things. So another thing with radios. So I just told you that it's a good thing no one's using these because we don't pay for the frequencies. Do you know what happens during an emergency with radio frequencies and rules? It all goes out the window. You can use any frequency during an emergency at any time. You can't practice with these radios, but you can use them during an emergency. So they are not completely just a paperweight. They can be used at some point, but you need to have that state of emergency issued. But again, if they're if they're up and running, but there's also, you need to know what the distance is or make sure the repeater's working. There's other things that do go into it, but they can be used. I've already showed you how I have a couple satellite phones, but RERAs also have these things to help communicate if needed be. Ham radios, again, check with your local EOC, check with your local county, see what they have. We used ham radios during an exercise to go from a special needs shelter back to the EOC and back to the health department. So we've practiced with these things. We had some hiccups. We learned how they need to operate. We learned how we need to operate, but we got that worked out during an exercise. We did it like in Lafayette and in Swanee in the same day with those two groups. Again, it doesn't say anything complicated, but it's good to practice. Yes, sir.
You said before that with regards to the satellite phones, you need to make a phone call to activate the satellite phones.
Well, that's for us.
Right, but if phone lines are down, how do you make a phone call to activate the satellite phones?
Well, and again, that's where you can, like if Publix has a satellite phone, your EOC can then activate it. You can make phone calls through them. You can go to the police department. You just have to kind of think outside the box of, I don't have anything, but maybe I can find out another state agency, another group, another county can help me out in that case. So yes, in some aspects, not having it activated and you lose all this stuff, how are you supposed to activate it? It's a good point, but I just had this conversation with hotels and restaurants of how do they contact their people when they're all throughout the state. Well, just think outside the box of what you're just kind of the immediate stuff, and maybe you can find someone else who can help you with that. But that's just something you need to plan for. So it's a good point. I think the RERAs have theirs active all the time. So it's not so. But how do you contact them too? So there's those questions you just need to iron out, and these are things you need to be asking right now, because if you don't, what will I do if I've never asked that question? Then I'm at the same place that I was before, except I have this pretty yellow box sitting next to me. So, so you can use unlicensed frequencies during emergencies, request the communications trailer. There's also this thing called the Government Emergency Telecommunications Service. It's the service that you can pay for that will give kind of your phone priority over other cell phones. So how many times during an emergency is the problem not so much the cell phones are down, but you just can't get a call through. If you sign up through this system, you can actually then get one of your phones, or maybe even if you're a health department, you get one or two phones that are signed up through this system, and that way you have that priority, so during an emergency you can still do your job and still be able to communicate as needed. Again, there's a small fee for this, but it's for kind of first responders primarily, but people can sign up, so it's not a bad thing to check out. Press releases. It'd be ideal if everything was kind of like a hurricane and you had 7-day notice that a hurricane is coming. You may not know where it's going to hit, but you have time to kind of get ready for it. Emergencies don't always happen that way. But if you can, the more things you can do ahead of time, the better you're going to be during the event when it finally happens. Because how many times is it that all of a sudden you have 50 things you got to worry about? I know that's your daily basis, but during an emergency you have 50 things you got to look at and try to figure out, and remember to do all those other things that should be going on. And if you can do some of these things ahead of time, like our press releases get updated once a year. So as soon as you get the email that says a new press release is out, go ahead and start putting your stuff out there. Get it to your PIOs. Get a copy maybe over to your EOC. That way, if you need it, you have the current one and you can start working on it without having to remember where is that stuff located at.
Is that search portal still there? With all the moving stuff?
Well, is it still there? Yes. Has it been updated in the last 2 years? No. Should you go to it? No. Unless you want to know what was out there, then you can go say, hey, what's the current version of it? So the Office of Communications is finally okay with the sections having, which it's kind of bad for the PIOs in a way, but giving the sections the right to their press releases. So we have all of our press releases on our EH Preparedness SharePoint site. And we've gotten them approved through communications, so that, you know, as long as minor updates or changes are done to them, they can be sent out right away. But the Office of Communications has has a list of campaigns. Underneath the campaigns, they break it down to the different sections that they have their press releases that they can do. But it's kind of like the search portal. You know, you may have like the same topic under 2 or 3 different things. Which one do I have to actually click on? And so us and EH, we've thrown them all together. I'm not sure how the other sections, bureaus are working, but that's how we're going to work, just kind of a one-shot for our stuff. Like I said, pre-fill in the information, and make sure you have a current list of who needs to get this. Make sure you have a contact for your radio, your newspapers, your whatnot. But also, make sure you know who your PIO at the EOC is, because maybe they can get stuff out too, so you don't have to. Or maybe, you know, because, you know, that's kind of what their job is, to contact all these people. Hey, give it to them, and they can pass it out for you.
And if you give it to them, then they put it on their website, their Facebook,
Exactly.
So it's easier.
It reaches more people kind of quicker.
And the media's gonna contact them anyway.
Yeah. So that's, you know, again, knowing your avenues of and being able to use your EOC even during blue skies times is ideal, and you can reach more people, which is better. Make sure your computers are up to date. How many times do you have an extra computer that sits in the storage room and then doesn't get connected to the network for a few months, and then you can't use it because the system doesn't recognize it because it hadn't gotten 2 other updates that it needs to be considered on the thing. Make sure your tablets and cell phones are charged and you have chargers. Know how to get help during this time. You know, make sure you know who to call. You know, like our environmental health database has a help desk. You know who your locals are, and a lot of times it may be regional. So, you know, make sure you know who to contact, you know, for all that stuff. And you know, make sure if you want to use the application we have for the emergency assessment, make sure that it gets loaded on your tablets, and make sure you download the current information. And we'll be talking about that in a little bit. This is just a screenshot of what was in the EH guide. You don't need to read this, but we have instructions on how to install the application onto a computer, onto a tablet or a laptop. Here's so that EH assessment is made straight from the form. I just mentioned on our EH director's call on Thursday, we're going to work on updating this form. So we're going to start getting with a couple of you guys through different committees that are out there to see what parts we want that are in on the next slide. But we want your input on what you think is important or not. Do we need certain sections? Do we not? And then also look at the current risk assessment, that, you know, how we do our inspections to see what's high risk, low risk, and maybe put some of those things on here to make sure we're hitting the most efficient parts when we do an assessment. But we have, you know, the top part is the contact information. In the application, you download the stuff straight from EHD, and it'll auto-fill in a lot of that information, so you don't need to have it with you on hand. Then this section here all talks about is it present? You're not looking at violations. You're just saying, is there an issue? Like one of the questions, is there power? Is the power a generator or is it a grid? Again, you're not saying that there's a problem, you're just kind of doing an assessment of the situation of what you got have on hand. You look at water issues. What type of well is it? Is there a boil water notice that's out there? Do we have any structural issues? Do you have any needs that are out there? You have a generator but no gas. You have a lot of water around there, so you have mosquito issues. You know, you're just doing an assessment of what the thing is. And this last part here is a referral. Do you have to send this stuff to any information? Do you have to get it to code enforcement, the building department? Do you have to get it to DAX, hotel and restaurants, something else? You know, that's what all this captures. Section 2 is more of, is there any kind of violation-ish stuff out there? And I'll explain why I said ish in a second. But this breaks it down to different types of facilities. You have food service, you have residential care, public schools, migrant camps, child care, and mobile home parks. So that way when you go do an assessment, you go down to whatever section that you're covering and you indicate what kind of issues that you may have. You know, do you have to take water samples? Do you have garbage on the ground? You know, what kind of issues do you have? So, assessments. What's the difference? I know it's up on the slide. What's the difference between an assessment and an inspection?
No violations for an assessment.
In assessment, you're just looking at the situation and saying, what is the current situation? Where in inspection, you're following our rules and guidances, you know, of what's correct and what's wrong. And you're writing somebody up. It's more of an education for an assessment. Okay. When do you do assessments?
That's needed.
When you're in a recovery phase.
Okay, when needed. So who tells you when that's needed? Because someone's got to tell you it's needed. Okay, so it may be like the EH director, it may be, you know, so it's whoever that person is to say, this is what we're going to do. When do assessments stop and you change to routine inspections? Whenever the incident commander tells you you're stopping, you're moving on, you're so again, there isn't it's not you have to do assessments, a hurricane hits you, so you have to do this. It's whatever, you know, your locals decide that this is what we're going to do now, and this is when we're going to change. Can you use assessments for your routine inspections? No, because you're not doing an inspection, you're doing an assessment. So it's kind of that fine line between you don't have a lot of staff to be going to a space 50,000 times, but you still got to look at the response and look at things. Now there's some food places you go to and whatnot that you normally don't go to during an emergency, but again, that's all going to be dictated by your local response and what you need to do. Does that stuff have to be sent up to the state health office? The assessments?
They can stay local if you're still responding locally.
The only thing that does for us is it gives us information of what you're seeing and maybe some needs you have. If you do this on the EH assessment, we'll be able to see it. So you don't have to send it to us that way. You do it on paper, you don't have to send it to us. You know, again, it's to help you guys do planning locally. What are my biggest needs? Where are my issues? And are those things, can we figure out how to solve them and get them solved? That's all it does. It gives you a planning tool. Again, if you want to talk to us about it, if you want to send it to us, you can, but you don't need to. There's not a requirement. That's just a local thing. In the guide, we also have general checklists. They provide standard course of actions. Now again, we're a state agency, you are the county. You county may have local rules that are more restrictive than what we have. So again, this guidance is based off of state rules, so you gotta also know what your local ones are, know how to completely respond. The checklist apply to EH response in affected area. They adjust to be made at the local capabilities to respond, so based off of what the needs and rules that you guys have. And the checklists are broken down into before, after, and to transition from response to recovery. Again, you don't need to read this, it just shows that there's a checklist. One of the things you may want to do is pull a report out of EHD, because what happens if EHD goes down and your expert is stuck at home because they can't come in because the tree fell on it, go do all your food inspections that are in the affected area, who's going to know exactly where all that is? You know, that's where it's good to have ahead of time. Make sure that you have contact information. It's good to know staff information. I know we have Surf Florida, but make sure you may need your own call down list so you know what's going on with your staff. You may ask your staff to respond to you to say, hey, I'm okay, I'm not okay, it looks like I'm going to be out for a while. So you guys can start planning for what you guys need to do. The nice thing about EH is we may not rush out right away. We have to wait until the weather improves, the roads improve for us to get out there. So we have a little bit of time, but you have other things going on at the same time. And you still have those contractors calling you the day after a storm hits, I want to put a septic in. So, you know. After the storm hits, again, these are things that make sure your staff's okay. Start going out there and are you going to do your assessments? What are you going to need to do? Do you have your press releases ready to go? Is there something new that just popped up? Are more people using generators and having issues, you know, with CO poisonings? You know, look at, as you learn this stuff, you may have to kind of change your thing, but you're still looking, where's the press releases, where's this, where's that? It's all kind of the same thing. And of course, make sure you know your local way to request things and the proper way of doing it, you know your chain of command. Transition from response and recovery. This is the whole list, so you don't have to look at that page. Basically, it's you being switching from a response to back to your day-to-day operations. So, facilities sections just does a few things in that section. Food, group care, biomedical waste, mobile home parks, and other things, statues, yada, yada, yada. So, in this section, we do have another breakdown. Again, it's very similar to the before the storm, after the storm, just give you more specific to facilities of what you need to do. Issues that we've seen. Carbon monoxide poisonings. One of the stories I always tell people when I went to Iowa, we were down where the flooding had occurred in, I think it was Cedar Rapids, wasn't it?
Mm-hmm.
Yeah. And I was with my partner, and we were going down and looking at these places, and we were just talking with people, seeing what they were up to and how everything was going. And we turned a corner, and right at the corner, these people had a generator. The generator was connected to a portable fan. And you're like, well, this is smart. These people are pushing in very fresh air down into this basement where they can be, where, get rid of the mold and mildew type of smell in there. But when you looked at it, the exhaust fan of the generator was pointing toward the inlet of the fan and going right into the place. So we walked in there and we started talking to the people, and we said, how's everybody feeling? And a couple of people were like, I'm kind of getting dizzy and nauseous. And we had our CO meters, and yeah, I mean, they may have not been calibrated in the last year or something, but they started going higher and higher, and pretty soon the alarm went off on those things as we got closer to the hose. So we got them out, we showed them what was going on, and we came back about 20 minutes later, and they started feeling better. They moved everything. We went back into the place. It was the CO went down into, according to the meters, back into normal ranges and stuff like that. And so, even though we don't regulate, like CO issues, there are still things we can do to help people. That's still a health issue. And they were, no one got sick that day because we got them out early enough. But those are the things that, that how we can touch people, how we can help them by doing those small things, just by being there. And, it still hits me every time it's telling that story, just because, again, we made a difference to those people's lives. They may not remember it, but I'm always going to remember that story. And so, just knowing, where some information is. One of the things that Tim had brought was keep your generator away OAD, so you don't become DOA, so outside dry, away and dry, and dead on arrival. So, you know, we have these things both in English and Spanish, and, you know, sometimes you show up to a place and no one's home, so we have door hangers that we can put on there to protect people. You know, we have press releases that talk about generators and keeping people safe. So we have these things sitting up in Tallahassee where they're being very useful. But again, if you guys need this stuff, request it. We can get it down to you guys when you need it, and use them. All this stuff has, I don't know when the last time this stuff really had changed. And so they're still going to be very useful for years to come, because, you know, carbon monoxide, until they maybe figure out there's a magic safe distance that you're always going to be safe, but with weather patterns and the whole 9 yards, they may never be able to say 20 feet, 50 feet is going to actually be good. Tim?
And if you'd like some, take some. We've got 23 boxes of these flyers and door hangers, so we'd like you to take them with you. I have a whole box over at the display table, so, you know, take as much as you want. If you want more, we'll send it to you.
Something I always point out to my staff too, before that, Mike, had you ever operated a CO meter?
No, I can't say that I have.
And were you concerned about CO as far as EH response? That wasn't even something we had talked about in our strike teams, right?
Correct.
So I always emphasize to my people every hurricane season, then going back around, is you'll get just-in-time training for some of these things that you actually do need. So whether you are totally prepared going into a situation or not, being open to whatever the emergency is dictating that you need, as long as you're not putting yourself in danger, that you've got to be open to all of that, because you will learn new things. And like you said, it's something now that you remember for all time, as far as your response and how you made a difference in somebody's life. And before you got on the plane to Iowa, you would have never thought that was going to be that case.
Yeah. You know, and has anybody heard the word Zika before? How many people in EH deal with vector control? Sort of. You know, it's a thing that we say it and we do it, and from the medical side, you know, they look at the diseases and stuff like that. But did you know we actually sent 2 EH strike teams to Miami to help out down there? You know, but we're not necessarily the vector control experts. You know, some counties have a big role in it, a lot of counties don't. And so, but we were able to go down there and help. We had just-in-time training on stuff that the county wanted us to do, and I'll have a slide up, not in this presentation, but in a little bit, that shows you, you know, like things, you know, that you need to be open to learn and be able to do. None of the stuff may be hard, but it's not only stuff that you can then go and learn, but you can bring back to your county and say, hey, we just used this piece of equipment. Maybe this is something we can use during an emergency, and it only makes your county better by these things that you learn. Problems we also have is improper cleaning of anything like contaminated items, mold-like substance. You know, this also kind of, well, and that's on the next slide, but then we also have water issues, flooding, precautionary boil water notices, things that you will need to be paying attention to and notifying different facilities if you have issues, and also know how to work them. And we'll get into this, actually this stuff in the next section. Again, the more prepared you are, the better response you're going to be able to have. Make sure you have your checklist, make sure you have your safety messages. The other thing, make sure you all say the same thing. In Suwannee County, I know this goes into a water issue, but in the first day, we had 3 completely different messages being sent out by the county about boil water notices. One message, the city of Live Oak was under a boil water notice. The next message, the utility company said, no, we don't have a boil water notice in the city of Live Oak. The third message was the whole county was under the boil water notice. And do you know who all said that? That was all from the county and different people saying different things, because they there's flooding, clearly that this means that. And so when you have other agencies ready to shut down all the food facilities in Swanee County, can you imagine the problem we would have trying to respond and get fresh water in there, fresh food in there, because everybody would then stop, wanting to go buy or go do anything of places that are open that would help us out to respond. So make sure you have the same message, and that goes for inside your own section, your own health department. Just make sure you say the same thing.
Let me add one thing about safety messages before and after and such, and that's, we recently had an issue over at the Cape with somebody who suffered from a heat stress. When do these things always happen? Always when the weather's hot. Always when there's no power, there's no air conditioning. People are a lot of times doing things they're not used to doing outside, and it's hot. Heat stress is a real issue, and people can get lost because of it. Having a safety message prepared regarding heat stress is really important, because you've got a lot of people out there, like I said, who are doing stuff that maybe they're not familiar, but they're getting started involved in cleanup and trying to recover what they can from their homes and stuff like that. Hydration, taking the frequent breaks, stuff like that. Making sure that information's out there is important. And like I said, we just had a guy who had a problem. He had a local food truck. He was out at the Cape and, taking some medication, didn't realize how hot it was, sitting out in the sun in his food truck, and, had to be taken to the hospital. So it happens. It's more likely to happen in times like this. So make sure that's included in some of your messages.
And the other thing to do is have a place that all these messages are kind of kept. Like one of the things is, we get a lot of emails up at the state that ask a wide variety of questions. Most of the time, if one person has asked that question, somebody else from the same county is going to ask the same exact question. So do you want to remake that message every single time? No. Have a place where these messages are kept in a single place, so you can just pick them up and go. You don't have to reinvent the wheel, and the message is basically going to say the same. Now, yes, things do change from time to time. Things do need to be updated and reviewed. But most of the information is going to be pretty consistent. So know where your county keeps these things, so that way, one, if the main person's out, that someone else can get there, but two, that, sometimes, if you keep showing the people the same message, it'll, they say things happen in threes. So once you maybe tell them 3 times that it'll be this way, they'll start saying it. Or the other thing is, it also helps say, hey, because I know when I was in Swanee, people, news people would call me and say, I need to do an interview on this, this, and this. Knowing the people to, be able to say, hey, you really need to talk to our PIO, you really need to talk to so-and-so, and being able to have that answer of just go talk to them will maybe give your people a little bit more confidence of then if they get those phone calls that they won't feel like they have to answer it, is they know where to go to, and then that person is ready to go because they have their set answer. And so that's, having all this stuff in place under blue skies during an emergency, it'll become more second nature and not just, I don't know what to do. Which then you look bad, that makes the department look bad because you can't answer the question, but just direct them to your EOC, direct them to your PIO. That's the best way to handle it. Food issues. We've seen food stations where people are just using a bucket to wash their hands. We've seen temperature issues and people are going off to be sent for ice, try to keep things cool in time, but then the ice melts and so you got that issue. We have issues coordinating with other agencies during that time. When Hermine hit and shut down the government agencies that are like in Jacksonville, that was the DEP's headquarters. Now they're shut down, and how do you get a message to them when their office is closed and you can't send just like a fax either,
What's the food safety issue with regards to DEP? It's something completely out of their purview.
Water issues. If boil water notices that deal with food. But no, yes, that doesn't quite, the other agencies do with food. And then inspectors unable to work, or you get people who show up and say, I'm not from the government, but I'm here to help. That, you know, you gotta, because you can't just send anybody to do a food inspection. You gotta be trained, you gotta be certified. Food inspections have to start as soon as possible after the emergency, especially for the emergency feeding places. And your EOC is going to have a list of those things. They're going to know where the shelters are. They're going to know where some of the feeding stations are. It's a good place to start out. Now, yes, you're always going to have those few churches and whatnot that pop up and want to start serving food. But if you can start kind of getting those lists together, you don't have to create the wheel from the beginning. You may get a round stone that just needs to have an axle added to it or something, you know. You just start someplace, you know, and that's a great place. And the sooner you can start these things, the sooner you can get them on the path of what they should be doing to prevent any kind of issues. One of the hurricanes we're looking at for an exercise at the state level is looking at Wilma, and we had a number of food outbreaks back then. We had 6 million people without power for up to 2 weeks. So, you know, knowing kind of where these places are early can help prevent those things from occurring. Request items and staff through EM Constellations, and request them early and give them time to recruit. And they're okay with you calling them and say, we don't need them anymore, you know, the issue's kind of passed. But like I said, when I needed an EH strike team, they were ready, they wanted to send someone down to me like the day after it hit. I'm like, no, because I gotta A, figure out where I'm at, B, the roads aren't even gonna be clear enough for us to get out there, that all of these people are gonna do is come and sit in Suwannee County in a hotel room for like 2 days, 3 days before we can get the people out there. But that also gave the state enough time to find the people who could come and come out to our county to help out. But again, the earlier you can request stuff, the more likely you are to get it. Now, like I said, things do change, needs change, that's fine. You know, before it ever leaves for your county, you can change your request and we can get you what you need. But make sure you, A, give us time, but B, you're also specific about what you need. And then, you know, of course, having handouts always is, you know, if you can educate the public, that just makes your job a little bit easier. We also have a section on biomedical waste. And this is basically taken straight out of your 150-4. But this stuff is also, most of that stuff is in these kits already. So these are just things that you should have on hand, inspection forms. And then always, access to a camera. Yeah, most people say, well, I have my cell phone. Well, if you have no electricity after the second day, is that cell phone really going to be a great camera? So you may want to have those backup, either disposable or a backup camera. I won't make you read this, but these are just ways to handle a bio-waste containment and what to do and make sure that it gets handled properly. So any questions on facilities? Water issues. Water issues, you get flood water issues. One of the things we have in North Florida is the Valdosta sewer plant overflows and comes down the Withlacoochee and hits the Suwannee, and we had issues there. There's leaking underground gasoline tanks, which if you're in the Super Act program, you know a lot about that. Low pressure, allowing infiltration of pipes. And this is why, so do we normally do a blank boil water notice for private wells? Like we're just gonna say the whole county has a boil water notice. Is that stuff we do on our?
No, we leave. Tell them if their well was flooded that they should boil their water, but we leave it up to them to determine whether their well was flooded. You might tell them if the well goes over the wellhead, if the water goes over the wellhead.
Now, if they lose power in an area, do you then tell them to do a boil water notice for private wells?
Now you're kind of into a gray area. Possibly.
We at the state recommend no. And that's the point where I was going with to this. Is the reason if like a DEP, a public water system, loses pressure that goes under 20 psi, we do a precautionary boil water notice, is because they have a lot of points at which those lines come into that system. It's not just on a private well. I mean, yeah, you may have 1 or 2 lines that break off, but typically it's just you have the well that goes to the house or to your holding tank, and it goes to the house, and that's pretty much all the the pipes that go into that system. On a public system, you have a lot more, and when you have a lot more, you have just a bigger chance that one of your backflow preventers or something breaks down, and so you just want to be on the safe side. So that's why when we do lose pressure on a large system, we do a precautionary, but we would not on a private well. Now on a private well, if it becomes flooded, because that means water gets above the well, a lot of old wells don't have a bentonite seal around the outside of the casing, so you don't, basically, rock when you hit it with a blade doesn't break just pretty and clean, and you have this nice hole for that a seal goes, nice seal. You need to put stuff around there to create that seal. Or sometimes they don't have that little port plug at the top, and water rushes down, and you can contaminate the water source that way. That's why on a flooded well you do recommend a boil water notice, but you would not just for losing pressure on a private well. You lose power in your area, and you may not have any more water labs to test that water that you tell them that they're under a boil water notice. And issues with precautionary boil water notices, confusions over boundaries of the water system, or improper information. They say there's a boil water notice, but they don't tell you what you can and cannot do with that. Why there was a boil water notice. So one of the things you can do, one of the things that has happened recently is the potential to waive fees for the state lab for BACT testing. If there's a FEMA declared or federally declared emergency, that's most likely going to be, say, yes, because we know we're going to get some money back from the state. If there's not, who pays for this water testing if we're not charging the public?
Department of Health.
Yeah, so the local health department would have the shipping fees to get it to, or a transportation fee to get to it, and then you have the Bureau of Laboratories, who's the one who actually is running the test and using their own equipment to do it. So you have twofold of, so basically we're kind of absorbing this cost, and we're not made of money, you guys aren't made of money, so that's not necessarily a possibility, unless maybe if we know there's only like 10 people involved, then maybe that's something simple, but that potential is there, but it's not a guarantee. So you guys can ask. You may not get it, but you can always ask. Another thing you can do is request a mobile lab, and one of the things that the lab does is literally puts incubators and things into an RV and brings that out to your county and can then run the samples there in your county. So if you don't have any approved labs within 50 miles, you can request that through the state.
Does that come with the people that know how to run the lab?
Yep.
All right.
No, that's up to you.
Good. You sent without the people.
And then, joint communications. Make sure, again, this goes back to like the thing with Debbie, make sure you're all saying the same thing, and make sure you're communicating with each other so you can all say the same thing. Communicate with the utility companies. Again, learn who those people are. I understand that in most counties, DEP is in charge of those public water systems, but hey, have a meeting with them. Do I cover that on the next slide? No, I'll get that shortly, so I'll ask that question. Sampling kits and purification tablets. Now, a lot of these purification tablets are starting to be expired. Again, we can get some for you guys. And sometimes in sampling kits, I'm like DEP, like with Pasco with the sinkhole that they had. We had DEP was able to get samples down, bottles down through the Super Act program to the county to test 20 wells to see if we had any issues besides just bacteria. Knowing, just how to request or where to request this, or that you can request these things, can help when you have an emergency, just to be able to react faster. Know how the water systems are interconnected. Again, that's not necessarily you need to know that, but need to know who to talk to see what the issue is. Because if the parent system has a boil water notice, then all subsequent ones have too, unless somehow you can shut that off. And like, one of the issues I think near Cape Canaveral was the main system had lost power, but the secondary system had its own holding tank, and they never lost any pressure after that. And so they were able to shut off the one system, and so there wasn't a boil water notice, and they were able to get it back online before they ran out of water. So there's ways around that, but typically, if one lost pressure, most likely the other one lost pressure, and it just is sequential. Another thing that can happen is surge capacity. The ideal thing is the utility company fixes the problem, but still water testing and other things still need to go on, and they may need to have extra people to go out there to assist and just to do the sampling aspect of it while they deal with everything else. You can request for people to come in to help us collect those water samples, so it's not just up to you, to the utility company or the county. And then always there's SMEs there to assist as needed. So, who can issue boil water notices for DEP systems? Okay, who should issue the boil water notice?
The agency.
Well, the utility company should be the first one who actually does it. If they don't do it, who should? Well, DEP or us. We can do it. So don't think because it's not our system we can't touch it. We're here to protect public health. So who writes the guidelines? Who actually wrote the guidelines for boil water notices and how to handle them? DOH is the one who did it because we have the rule to protect public health. So we wrote the rule and then DEP adopted our guidelines for how to do it. So, so there should be coordination between the county health department, DEP, and utilities. One of the things we have during an emergency is that the utility company should be notifying you guys locally, even if you're not a regulator of these systems, that a boil water has gone on. Both during emergencies and during blue skies, they should be notifying the state watch office of boil water notice, so we should get a notification that we can get it down to you guys. And one of the things we do at the state is we can contact other food agencies that a boil water notice has occurred. So if you guys ever have one and you want us to do it, you can let us know and we can send a message out, because we have a whole bunch of things, and one of the emails we have are all food inspectors for Department of Ag. So we get it out to everybody, so they're aware that there is one.
Excuse me, did you say the utility is required to report it to the state board?
Now, and I think it's maybe more commercial type and not, community, not commercial. I'll need to check on if it's both or one. Yeah. And then of course, if we issue it, we need to make sure we're in contact with DEP and everything. And if it's during emergencies, we actually have a list of boil water notices related to the storm on our website. And so that way that's another way you guys can learn about boil water notices. When the strike teams were out for Matthew, we were sending it to the strike team leads for the counties they were in, just so the leads knew what was going on. How many samples does it take to lift a boil water notice? Well, it technically depends.
Usually it's 2.
Well, at the end of the day, the answer will be 2. But you can lift a boil water notice after 1 if it's just loss of pressure. If the pipes break, you have to do 2. If it's a boil water notice because it's a bad sample, you got to do 2. But if you have one just from a loss of pressure, but not any breaks in the lines, you can lift it after 1, but the second one is required before you officially lift it. And a lot of utility companies don't like to take the risk of lifting it after 1 day and turning around and putting it back under, because then someone's probably going to come back and sue them for saying, hey, you said it was safe and now you're not. I've been drinking it for the last day, and if they get sick, you know how that goes. So, at the end of the day, it's usually 2, but the rule does allow for you lifting it after 1 if they choose to. And we also have, in our guide, we have a list of questions and things you may want to think about when you issue it. We also have a nice template on here. Don't just fill in the lines and send it on, because we say, well, it could be this, it could be this, it could be this. So read the whole thing and make sure you edit it to what's going on in the situation before you send it out. But this template will cover everything that's required. And it's amazing how many boil water notices we see at the state that don't have at least 1 or 2 of these sections. But you just give them this, or you guys have this, and you know you're going to be complete. But again, make sure you're reading it and eliminating the parts that don't have to be there, and make sure you have a contact name and number. You know, even if you're the one who sends it out, the utility company may be the one who's best to be getting the calls. You know, put their name and number. Make sure you're talking with them, that you're just not throwing them out there. You know, but again, this, if you follow this template, Ed Bettinger sends this out to the EH directors at the beginning of, or close to the beginning of the hurricane season. We have this on our SharePoint site of EH preparedness. It's out there. You can email one of us. We can send it down to you if you need it. Storm Tracker. Who's heard of Storm Tracker? How many people have used Storm Tracker?
Not the easiest thing, sometimes.
Well, it's nice when DEP gives you a nice, more powerful password that you can do more things with it, but they keep that to themselves. But anyways, I digress. Storm Tracker is activated during state emergencies. This is a great place that you can potentially find out the status of all your public water, or not all your public water systems, your public community, like non-transient water systems that have like 3,000 or more people connected to them, that you can go and see the status of them. You can also find the name of the utility company and a contact for that. So if there is an issue, you don't have to figure out who's in charge of it, who can I call. They give you a couple contacts on here. You can go in here. You can search, you can pull reports by just your county. You can do, you know, you can, and that has both water, drinking water, and wastewater facilities. So it kind of gives you an idea of everything that's going on. This has the potential of being a great system, except if no one puts any information in there, then it's only as good as the information going in. We tell them, or DEP tells the people, the utility companies, you're required to do this during emergencies. It's great before the storm when everybody has time to put the information in. When everybody's running around to make sure their system's working, this doesn't always get updated. Or DEP is slowly getting the information in and may update stuff slowly. We still have boil water notices from Hermine in the system, so it's just current information. But again, this is, I know I'm not speaking highly of this, but again, for an emergency, just knowing some of the information, even knowing something is better than knowing nothing. And this can give you some of that information. You know, if it's a small county and you may not have too many utility companies, you can quickly, or you can also have a meeting set up by knowing who's in here. This actually also has history back to 2006. So if you want to look at your county, you know, like look at different storms, and if your county was affected, you can say, hey, do I see that there's a history of this one location usually having boil water notices? These are the people I may need to contact. You know, this is just kind of gives you that information again. You know, because it's not 100%, it may not give you everything, but it gives you something, which is better than nothing. And on it, it gives you the public water drinking system number, the type of system it is, the population it serves, what office for DEP that it's connected to, what county it's in, and the name of the system, an address, and the city. And the nice thing is during any storms, any information that's put in after that storm started will be generated right here. So you don't really have to click on every single one at first to see what that current status is. And then it also will tell you what the standard is. Now, sometimes things are operational, but you may end up having a boil water notice. You don't see the boil water notice necessarily on here unless they have a comment, so you may have to go in to learn that information, but that information is in the system. So any questions on water? Okay. Sanitation issues. OSTDS, sewage basically. Overflowing lift stations, you know, that's like the state watch-off reports we get. Spills that contaminate surface water, how many, you know, we had, I think like 1 million gallons that overflowed into Ball during Matthew, you know. Plants overflowing because they lose power, or, you know, and of course when lift stations go down in Tropical Storm Debbie, our 3 closest lift stations that got the water to the plant all went down. And so we just had sewage downtown, basically, and there was nothing, you know, they couldn't get to it until they can get the generators and stuff back out there and lift them up high enough that to run them and activate them again.
I'm
but-
sorry, but why did the lift stations go down?
Because of they were overheating from because we had the stormwater also went into those things too, so it's just overuse, and then the electricity for them just shorted out because of the flooding.
I mean, don't they have backup generators at lift stations, or not necessarily?
Not all of them do.
Uh-huh. So these were cases where they didn't have backup generators and you had to get generators to them? Is that?
Or we had one that had a backup generator, but the backup generator failed on us. But a lot of smaller systems, may not have those generators. They have connections for a generator to be hooked up to, and they assume that they're going to get out there quick enough to not have a major issue. And so those, they had hookups, but didn't actually have generators out there.
Or they may only have so many expecting not every one to go down, so they've got a limited supply, and then the utility has to choose what areas to deploy them in.
Correct. And that's, where then talking with the utilities ahead of time to figure out where your potential problems could be, try to learn those ahead of time. So, and of course, then we have on-site issues, including floating and collapsing tanks. Cement tanks do float out of the ground. They did try to make a cement ship years ago, and it floated for a while. So you don't have power. No power now. And yeah, when we think of septic systems, typically, there's no electricity that goes into it. It's all a gravity type system. But then you still have lift stations, you have ATUs, you have performance-based systems that still require power. So just because it's a septic tank, you may still have issues without power. And then saturated drain field. If your drain field is saturated, where's the water going to go? Who knows what sanitary packages are? What are they?
For the most part, they are portalettes and hand wash stations attached with them.
So Florida had decided we need to figure out a system to get a whole bunch of portable restrooms out to different places, because if a community has a package plant goes down, they still need to go bathroom, they still need to do it, but we don't want to have that sanitary nuisance. So we've come up with these sanitary packages. In the packages, we have portable restrooms, we list dumpsters, and then we list other things to be put into your request. Because you may say, I want to put the portable restroom out there, and I need a dumpster, and then they don't think, well, it's going to cost money to go pick them up, and that's an extra fee at the end of the day that you may not have really thought about. You still had to do it, but you may not have. But if you request this from the beginning, it just makes it go a little bit smoother. So we have information on what to also request. Maintaining a vendor list of your portable restrooms. Again, your local health departments, you issue permits for people with portable restrooms. So have that list ready to go if you need it. But you can also request it through the state if needed, and ours is a nationwide, so that way if enough is needed, we can pull from other states too to get it in there. But we don't have to find it, we just give it to them.
One interesting thing after Charlie 2 in, I think it was Punta Gorda at Robards Arena, they didn't have shower washing facilities there. So with the length of time that people had to stay in the facility, they brought in portable showers, but then they were just discharging them into the parking lot. So people have to remember that the gray water's got to be captured and taken to a correct treatment facility as well. So all of that's not supposed to happen on a large scale either, but we live and learn.
Yeah,
Capturing of gray water is not an easy thing. That's a lot of water. Can't they just send it to the closest stormwater pond and just let it sit there?
Well, they're not supposed to.
Right.
Yeah, but in an emergency.
Well, their answer to it for the emergency to begin with, like I say, was just discharging it onto the parking lot in an area that wasn't being used for parking. But eventually, we ended up having to correct that.
Well, because again, during an emergency, you do what you need to do to get the job done. But at the same time, you're still supposed to be following all state rules unless anything had been, by the governor, has been, you don't need to follow this, or the Surgeon General for DOH. And so you still need to follow whatever guidelines we're supposed to. And we're not supposed to change one hazard for another hazard. So, normally that stuff is being captured and treated, that's the way it should be done. But a number of people, counties will request oxygen tanks. So you get a whole bunch of oxygen tanks, but you don't have the equipment to actually, to take the oxygen out of there to get it to the patient. So you gotta, when you make these requests, and I'll be showing that here very shortly, is when you make a request, make sure it's as complete as possible, and you make sure you're trying to plan for as much as possible. Yes, no one's gonna fire you because that's what happened, but we need to prevent that from happening again if we can.
Right, and for us, we knew, that those people needed showers, so it wasn't like that day we shut down the showers. We still let them go ahead and shower until they could come up with the arrangements in order to do that. So
right.
It just becomes, like you're saying, kicking the emergency at least
down
the road a little bit to try and help. So common sense rather than a revolt.
the most you can do. That's like, we in this guidance, we actually say, if there's raw sewage on the ground, you need to basically have these people leave their home within 6 hours. Have we ever kicked anybody out of their house?
In 6 hours?
In 6 hours. But that's what the rule is. But we use common sense to say, okay, make sure you're starting to solve this problem. Either pump your tank out, on a routine basis so we don't have the sanitary nuisance, get a portable restroom to do it. There is, and one of the things we changed this year is we actually have now kind of allowed you to take your existing septic tank, cap it off, and use it as a holding tank, until you can get your drain field, like if your drain field washed away, just do it that way and have it pumped out on a routine basis. So we're not kicking you out of your house, but we're trying to prevent any issues from happening. So again, you see a problem, figure out how to solve that problem without doing too much harm to the environment, to the person, to anybody else. Just try to, get to a place. Because even on sanitary nuisance, you give them a couple days to resolve it. You just don't stop it right then and there.
And Adam, one issue on the portable hand sinks, make sure that the company that's supplying those and maintaining them actually has a potable water well to provide water for them. We did have a problem at the Space Center years ago that they were providing them, but it just seems that the company that was providing them didn't have a potable water well anywhere on property to provide their water. And we were taking bacterial samples and it was nasty.
There's, and you make sure you have a company that can dump that once they maintenance these and make sure they have a place to put this stuff. There's a lot of things, more than just get it out there to help this, because then there's other things that you gotta think about too. And like Brian said, you have your portable restrooms. We actually have both a standard and an ADA type, and then we have our hand washing sink. And make sure you have soap and towels, that it's not just water. So in our table, in our guide, we have this table here, and we list 4 different types. The type 1 is for the largest type, up to 4,000 persons per day, and type 4 is 500. We should have a comment here if you have less than 200 people, what you should do. So where we didn't have this comment down here before, it literally just stopped at 500, and then if it was less than 500, not that we didn't care, we just weren't giving you guidance, and we're starting to do that now. And then we also have what we recommend these for. The one thing to keep in mind is this is persons per day. You got to think, not only just like if you bring it to a community, don't think about just the number of people living in that community, but what about the people coming to that community? You have a staging area. It's not the 30 people that are going to be there full time. It's going to be all those truck drivers coming in too, all the meetings you have. You got to think kind of outside the box, is not just this is the number. Think about the potential of what could be there based off of what's going on. We also have guidance for FEMA trailers, and when a permit is needed or when a permit's not needed, and what the fee is and all that. So this is, so we have guidance about all that in here, and it's just kind of 2 paragraphs depending on what's going on. Any questions on OSTDS? Public health issues. We have, in our toxicology section, we can advise on indoor air, pesticides, harmful algal blooms, mercury spills, radon, and we can, of course, consultations on different things. Hazardous waste sites is another thing that we consult on. So for CO, I know we've already kind of gone over this multiple times, but never use the generator indoors, always be outside and keep it dry. Install a battery operated alarm or plug in with a battery backup. And the one thing that I know, you should look at these things and when the alarm will be going off. So just because the alarm isn't going off doesn't necessarily you don't have a long-term problem, but it looks at these things, or you may have a problem and it won't go off for like 30 days because it finally reached its max. So you read what the instructions say, and these are more these are a better indicator for an immediate health risk than a long-term. So just pay attention to what you have, but again, make sure it's a battery operated somehow, because if your power goes out, then that's when you need your generator. Is that alarm actually going to be any good for you? Remember, you can't see or smell CO, and if you ever start feeling sick, dizzy, weak, get to fresh air right away. You may not have any long-term effects, but get that fresh air, feel better. If something's wrong, you need to do something. Anything else you want to add to that?
The flyers up there, the door hangers kind of contain a lot of that information. There's 911 or Poison Information Center, which is a national number. So if you take those flyers to Texas, those numbers should still work.
Maybe I should change this to mold-like substance. Sorry. Again, we offer advice. We're not mold experts. We're not testing for mold. But
mold regulators.
We're not, thank you. Remove standing water and wet material as soon as possible. They say 48 hours. And again, it depends on the sport type and the situation and yada yada yada. There's a lot of things that go into it. But they say if things stay wet for like 48 hours or more, you have the potential of getting mold to be growing. So you want to get that water out as soon as possible. You want to clean it as quickly as possible. And if you can't ever fully dry something, like if something soaks in water, you may just end up needing to get rid of that completely. I understand that costs money. I know homeowners don't like to hear that kind of thing, but that is a possibility if you can't dry it and clean it completely. Consider using protective equipment, personal protective equipment, such as gloves, goggles, and an N95 mask. Know what your limits are. And I know in this case we're telling homeowners to do this. We're not actually going out there and doing it. But again, make sure they know what their limitations are before you go do something, or if you're doing something in your house. And remember not to mix cleaners and disinfection as hazard gas can form. So again, know what you're doing before you go do it and read your warning labels. You have anything else? Okay. Vector and zoonotic issues. Mosquito populations can increase between 5 and 14 days after flooding. Of course, we can then have problems with zoonotic diseases and responder safety. So, yes, that's on the slides. And then also, just like people, animals don't like to be living in water if they're not in water. So that means the animals move when things get flooded out. And so that increases the chance of interactions between you and an animal that you may not normally have an interaction with. So we do see an increase in animal bites around flooding times, and then it also increases contact with other things. I think it's neat how ants can come together and form kind of a ball and float on water and go in. I think that's pretty neat, except when it's coming towards me. But again, just be careful that things are going to move when the ground is wet, and be prepared for it. So, work with your local EM to call if you have a mosquito controller, or however your county does this. Work with them. Put missions into EM constellations if need to be. Briquettes. mosquito repellent, whatever you need. Make sure that, again, gets in early if you need it. And if you request mosquito spray to go on, is there a role from environmental health when it comes to the request of mosquito aerial spray? What is that? What is our role in that?
Letter of support.
There's a letter that they require from the health department that usually EH is the one who writes. Sometimes the administrator is the one who decides that they want to sign it. Do you have to come up with that letter off the top of your head?
It's in your guide.
What?
It's in your guide, I think.
The State Agriculture Response Team website has a great website with a whole bunch of information. They list the, they have it, and DEM actually has like a 2-page report of everything that needs to go on. It talks about you need to be a declared emergency. They would like 3 years of baseline mosquito data. Your FDAC should be able to assist with that. And then it requires that letter from the health department that it's either hampering a response or a serious public health risk. But you go to the State Agriculture Response Team website, they actually have a sample letter for you that is, and they update it every year. This last one, they actually wrote Zika in there, you know, as a possibility. So again, that letter's there. It's not anything you need to come up with. Now it is in a PDF, so you gotta, you know, get it changed into Word, but it's something you can do without having to really recreate the whole wheel. It does list both of those things because it is possible you could have both of those things as an issue, but just pick the one that is the issue if it's only one. We also have math about how to figure out how much briquettes you need to order. They have both a 30-day and an 180-day briquette. So one, make sure you know what you're ordering. But two, you know, this tells you like a pool issue. That you have a number of pools without power, multiply either by 3/4 or 4/5, depending on if you want to be conservative or not. Times 6, which is the number of briquettes that typically need to treat a pool, and divided by 400, I don't want no extra space there, but that's the number of briquettes per box. And that'll tell you the number of boxes you would need to order. If you look at the sheet that comes in those boxes, and you can get them online, they also talk to you about how to calculate if it's just like flooding that's going on. Now the hard part is it says if it's less than 2 feet of water, you know, it's 1 briquette per 100 square feet. If it's greater than 2 feet, it's double that. But how do you really know the depth of all that water? But the other side of that is mosquitoes are only mostly going to form in stagnant, shallow water. So it's not the deep water you have to worry about. It's just kind of the edge of the water where most of that's going to happen. But that's just, you know, it has all that math out there that you don't have to. But most counties, if they have a mosquito control, they do that every day. Just ask them and have them do it. That's the easiest way of doing it. And when ordering cans of repellent, we say order 6,000 per 100,000 people because a lot of families, you know, will share a can, or some people won't come and get them. But that's what we estimate. And make sure you order 1/3 that are child strength and 2/3 that are adult strength. So you have enough for that. So we just have an example. If you have 100,000 people, order 2,000 for kids strength and 4,000 for adults. We may have been, you know, asked to do a response role, but you know, a lot of this stuff also may fall into EPI, and a lot of it may fall under mosquito control. But you know, we're going to be there to participate. And make sure you have a county vector board and zoonotic liaison with someone familiar with these issues. Normally it's EPI. Know who your contacts up in Tallahassee are. Dr. Stanek is an excellent person to know. And you know, make sure that you are sharing materials with all these different groups to keep everyone safe and to be able to be getting that message out. And you know, mosquitoes may not show up for 5 or 2 weeks down the road, but make sure you're talking about it now, because when you actually do aerial spray, what mosquitoes are you killing? Usually. You're killing the ones that are in the sky. You're not necessarily killing the ones that are down low. And plus, you're not necessarily killing the small ones that are going to be showing up in about 10 days. So you know, make sure you're looking at the incomplete cycle and make sure you're talking about everything and planning for it as you need to, and consult your liaisons as need be. We have, you don't have to read this, but this talks about carcass disposal and what to do for different situations. The guide that EPI puts out there, you will not see this chart in there. That doesn't mean this isn't current information. That they broke this chart up into the different sections closer to what it went into. We keep this because it's still current, but it's kind of a nice short little table that gives you your guidance.
So how do you dispose of carcasses?
It depends on like multiple different issues. You got to look at water tables. You got to look at the amount that you're disposing. You got to look at your county to see how to dispose of it. So there's different. This breaks it down into the different sections of what you need to do. Radiological radiation issues. Modern stations could be disabled, and we may not be able to replace them quickly. Equipment is not calibrated. How many people have gone through that training and gotten that little black box that has a couple meters in it? How many people have actually sent it back in for calibration? Good. I'm glad some people have. How often are you supposed to do it?
Once a year.
Once a year. Does it cost the health department any money? The local health department? Just the shipping cost to get it to the lab in Orlando and back. Unless you have someone driving to Orlando, then they can just drop it off as they go in. So make sure you do that once a year. They'll do it. They'll send it back to you. But you know, because you know you don't want to show up and not be able to use your equipment. Then it's kind of like we're going to send you there and you have a broken leg and you can't help with this response. You know, we can get you this more equipment, but still, you know, if you can show up with what you need, it's better. Main radiation in like Orange may lose power, and of course you have all the same issues you have. Trying to focus on if it's you know, an intentional versus not. You know, you still need to help with the public, but they still need to figure out what went on and what the cause was. So the Bureau of Radiation Control is the lead, and they do have a 24-hour number if need to be. And like Tim says, there are some people in EH that do assist. Now, when there's a community reception center, let me stop there for a second. Does everybody know what that is? Does anybody who knows what that is? That's where, so if you have an event and so you want a place to be able to, it's kind of like an alternate care site. You want to determine, are these people really sick? Are they good the way they are? Do they just need a quick shower and you can move on? Or, you know, do they need more serious medical attention? What is the role for EH in those things?
Assessing contamination.
So we're the ones, hence why we get the black boxes. We're there to help determine if those people are, you know, are been contaminated with radiation or not, and we just make sure. So we're doing it from that aspect. Who actually runs and operates community reception centers? The Medical Reserve Corps is the one who actually does it. Radiation control is the one who's actually is the lead on testing the people to see if they're good. MRC, the medical people, are kind of checking them in, you know, documenting where they went and figuring out if any follow-up needs to go on. They're the doctors of the thing. We in BRC, or BRC is the lead, we assist with seeing if the people are actually contaminated and what needs to go on.
Your local MRC, or there's some state level MRC?
Well, that is a wonderful question, because like in Suwannee and Lafayette, I mean, I'm sure it's probably the same for yours, but I won't speak for yours. We don't have an MRC.
We have one in one county, but that's...
Yeah, so I mean, you know, BRC is set up that they could move it along. At the same time, ESFA can get the people in there to do it. So it's not like you're SOL. But technically how it's written is MRC is the one who's supposed to be taking the lead.
There's an MRC working there.
Yes, at the state there is, but that still doesn't really help out for the counties who don't have covered by an MRC. Some response planning that we go into is we talk about our ESF8 planning map and hazard vulnerability assessment viewer. Has anybody actually gone to this map? Does anybody know how to get to this map? Okay. There's a website that you can do both internally or externally from your home, and you Google ESF8 planning. I'm pretty sure that's what it is. I'll verify as soon as I'm done with this presentation. If you Google it, it'll actually pull up a website that you can actually pull up some of your county plans, some of these maps, and multiple different things to help you guys out from a planning aspect, and also have pull up state plans and stuff like that. And they have this ESF8 planning map, which I'll get into in the presentation pretty soon, that the, oh, I don't have much time. Okay, you can actually pull up your county and you can actually run a report of like facilities that are in flood zones, and depending on if it's a Cat 4 hurricane or just a, like you want to just know what's in a 100-year flood zone. You know, it has a map that you can pull up that data and pull a report and see what are your facilities that are at risk. We also have a situation status report questions, things from whoever leads EH, things they need to think about and help them determine what the next plans of attack need to be. We have incident action plan template in there and message mapping. We have EM constellation templates, press releases, table of organization with preparedness and the different maps. You've already seen this. You've already seen this. This is the template. And like I said, we've gone in and filled some of this stuff out to help you think, you know, instead of you needing to think of things, we threw some things out there for you to think about. For the EH strike team, like I said, we list the different types of needs you may need to help figure out and make sure we get the best team to you as possible. And that's that. Let me very quickly pull up this. Oh, ESF8 dashboard. This has a website that has a whole bunch of useful information, has links to your Everbridge. Again, I did not log into VPN. You can get this from any computer. You have your Everbridge, your EM constellations, Epicom. This is good for multiple different agencies or sections within the department. You have your different maps that are out there. And this Gator is the DEM's mapping system of things that they look at, and that may help you out during some planning. But this is the ESF8 map I was talking about, and in here lists just about all of our EH facilities and map for you. So you can look if you're either on a strike team going to another county, or if you're coming to in your own county, and you can pull reports of facilities that are in here. So, but like I said, ESF8 dashboard is on here.